Okay, it's 7 o'clock. I'm going to call the Select Board meeting of Thursday, February 12th to order. I got that right? So to ground maybe the board, I think maybe the public, sure. But the board has a difficult decision in front of us. And I know emotions are running high regarding this topic. I think today we received probably 70 emails from a variety of perspectives. We need to not lose track that we're the elected select board, elected to represent all of the town's residents. And we shouldn't lose track that we're all neighbors who like to believe, I'd like to believe, want what's best for Winchester, even if the paths we take to get there diverge. My goal for this meeting is that we can express our concerns constructively, listen to each other, and focus on the task at hand. We will now hear public comment, then we will get into our business agenda. For anyone who wishes to give public comment, please stand up and form a line. Okay, come on up. Take you one at a time. If you can sit near one of the microphones, state your name. Public comment will be 3 minutes. I'll start a timer. And we generally don't engage in public comment. We just hear it and receive it. So let me start my timer and then go right ahead. And if you're not in line by 7:05, we'll move on to our business agenda items. Go ahead.
Hi, my name is Christine Cronin. I live at 16 Hutchinson Road, and I'm here today as both a citizen, an educator, and a parent. I was at the meeting earlier this week, and one of the comments made was about the burdened families of Winchester. And so I'm sitting at this table right now speaking to you as a burdened family member in the town of Winchester. And I'm sitting here as well to plead with the group to fully fund and support the override. I am a public school educator. I've been a public school educator my entire life. I live in Winchester so that we can live near family, because family is critical to our child care plan. My mother-in-law is a widow. She wants to age in place here in Winchester. So I understand and do not take lightly the financial burden that an override puts onto every member of this community. It is not a trifle amount of money for me or for my family members. And I believe it is critically important. Right now, the parents in this community are already overburdened by the absence of a core academic plan and program in this town. The $1,000 that this might add to my taxes next year will be a pittance compared to the $180 an hour we spend on tutoring, because there is no literacy program. It is a pittance to what we pay for Russian math. And now Mathnasium has heard that there's no math program, and they're opening downtown. If you haven't been on Cross Street when the Russian math classes switch over, you should go, because the entire town is there. It's a traffic nightmare, but that's for town planning. We are already carrying the financial burden of the lack of resources that we are giving to our schools around curriculum. The community has been incredibly supportive around the buildings and the spaces. Our kids are incredibly fortunate to be in buildings that are of the current era. I have been a professional educator for 29 years. The academic program in Winchester is laughable. I meet with national experts across this country. I talk about curriculum. I talk about literacy. This is my job. And the absence of a core curriculum in math and literacy is absolutely ridiculous. It is like leeching as a medical practice. People would laugh. We are in that place, and our families are trying to make up the difference, and it is hurting our kids. So it is not something I'm asking you to do lightly. I will feel it. I am not going to have less vacations and things like that because I don't have them. I will feel $1,000, but I'm already spending it because I have to do what's best for our kids. And so Winchester loves to say, we're lean, we're lean, we're lean. But lean to the point at which you are undermining your own best interest as a community is not a badge of honor. It is foolish. A strong community has a lively family community. It is generational. Those children who are successful become our leaders. We have to invest. We have to fully invest. And as a steward of public money myself, then we hold people accountable. We went through this override. We put this burden on taxpayers. We expect you to spend it well. We expect you to come back to this committee with results.
Thank you. We've reached your time.
Thank you.
Thank you.
Hi, Select Board. My name is Jessica Roach. I live at 14 St. Thomas More Drive. I'm a District 6 VO parent of 4 kids ranging from ages 10 to 2. I'm also highly involved in the community, having served in leadership positions with FAN, the Parent Inter-School Council, Parent to Parent, which is a nonprofit focused on educationally parent-oriented content in town. I've served as a room parent in classrooms, and I volunteer my time whenever I can. I've spoken at the school committee in support of literacy changes. I was highly involved in that process, not serving on one of the committees, but I brought my youngest baby to town because I felt so strongly that changes needed to be made. And I know that my time commitments, while they're not insignificant, pale in comparison to members of the school committee, select boards, and other municipal and town employees. So I want to thank you all for those efforts. I've reviewed the State of the Town report. I understand that Winchester is in an unfortunate and unenviable position that our real estate taxes don't cover our needs. Our expenses are simply too high, our true operating costs and our capital needs. That necessitates the use of periodic overrides to meet our needs. I want to commend all of the folks that spent months doing deep dives to identify concrete, justified plans and timelines for capital expenditures, and the systematic method that the school administration used to outlay their priorities and implementation. I want to express my support for an override up to $15 million. These are real identified costs and needs of the town, not fantastical slush funds or reach goals. In talking with parents over the last 8 years in leadership positions at my preschool and in the elementary school, the common thread has always been a willingness and an expectation of the town to invest in our school and maintain our existing limited resources. The schools make up 70% of the budget, yet parents of school-age kids are historically underrepresented in town meeting and other portions of the government because of the significant time commitments, which are hard to swing when you're in the thick of it parenting. I had like 18,000 snack requests today. All of my kids are home from school, and I'm still here because that's how important it is. We know what our kids need, and that's investment in literacy curriculum, math curriculum, support in the classroom, and all of the things that the administration has laid out in their deep dives. These costs are necessary and they're justified. We're required by law to serve all Winchester students. They're not like, there's no like math fairy that's coming to teach these kids how to add and subtract and divide. With respect to capital planning, we all know that costs are rising unpredictably. When we make short-sighted decisions to defer projects, try to cut corners and move the problem down the road, costs rise. And when you don't take a proactive approach to fix things when they're manageable, it becomes more expensive in the long term. I urge you to take a long-term perspective and prioritize appropriately. As elected representatives for the town, you have a fiduciary responsibility to protect our assets, which includes maintenance and restoration of things like town hall, our schools, making sure they have operational HVAC systems, and that their roofs don't leak at a mere minimum. The last thing that I want to mention is a comment that I noted from listening to some of the board's internal discussions of the override and the ranges that different members felt comfortable with. I have an accounting and finance background, and Mr. Bayani's point that noted the increased return on investment for additional dollars of the override really resonated with me. We spend all of this time and money and effort to identify these needs, and it really behooves us to address them. Our taxpayers want us to address them. The parents in town want us to address them. We're spending more time and money to put the ballot measure on, and it makes sense to me to optimize the performance. If an additional $1 million results in an increasingly lower incremental cost than the overall burden, I would think that it makes sense to maximize that return on investment.
Thank you. Appreciate your comments.
Thank you.
Thank you.
Hi.
Good evening.
I'm Amy Poftak, 230 Mystic Valley Parkway. I'm also a town meeting member. I want to express my support for placing an override in the 12.5 to 15 million range before voters. I attended the meetings on Monday. I really appreciated hearing all the different perspectives. I recognize that affordability is a real concern, and I agree we should be very thoughtful about what we ask of residents. At the same time, I think there is a real cost to a more limited override plan for everyone, but especially for those who rely most on public services. Public resources such as the library, parks and playgrounds, among others, are core services, and our funding should reflect those needs. The same is true for our schools. Long overdue investments in literacy, math, and MTSS not only bring us up to expected standards, they also help level the playing field by ensuring all students have access to high-quality instruction and intervention, not just those students whose families can afford outside support. You've done the work to build a multi-year plan, and you've done a great job at it. I believe we should fund it at a level that makes the most of that work that you've done for the entire community. Thank you.
Thank you. Is there anybody else?
Yeah, these two.
Go ahead.
Say your name.
Into the microphone, please. We can hear you.
Don't touch it. Say Calder Brady.
I'm Calder Brady.
I live at 15 Clement.
I live at 15 Clement Street, and I think Winchester should have a pool because every summer we have to go all the way to Lexington to go to a pool.
Okay.
I'm Larkin Brady.
I'm Larkin Brady.
15 Clement Street.
I live at 15 Clement Street.
I go to Lexington to go to a pool.
And every summer I have to go to Lexington to get a pool.
So I think Winchester should have a pool.
So I think Winchester should have a pool.
Thank you very much.
Thank you very much.
Thank you, Brady's, for your comments. Is there anybody else? And if anyone else, please get in line if you wish. Otherwise, this, I think, will be the last comment that we'll take. And then maybe we'll read Mr. Rohan's into the record, but I'll ask the board. So go ahead, Hafiz.
Good evening, everyone. Good evening, Select Board members. My name is Hafiz Adamji. I'm a member of the Precinct 3. I'm a 31-year resident of this town, and I do not have children. My wife and I, unfortunately, were not lucky enough to have kids, but we have been glad to support the education system in this town for 31 years because we think it's something that the community deserves, even though those benefits largely do not come to me. I am here to ask you to please go with a smaller override number, and the reason I'm asking for this is because we have had a complete lack of accountability in our school system. Our school system has, as all the previous speakers have stated, failed us completely. But the same administration which has overseen that failure and which has not proactively sought to address those issues remains. And as long as that school administration remains, we are just going to be throwing good money after bad. I think that is a bad decision. So I would ask that this is the last bastion, as it were, of accountability, because we hold some control over the funding, even though we have no direct control over the schools. And I would urge you to please hold the schools accountable first before we fund them. Thank you.
Okay, thank you. Select Board members, in front of you, there are written comments for us to consider. Would you like just to take a minute to read it, or would you like me to read it into the record? Okay. Sorry for us with the pause. We're just going to read Mr. Richard Rohan, Precinct 2 town meeting member. We good? Okay. Thank you, Mr. Rohan. All right, so now we will get into the business. We have 3 items this evening. We need to vote an override amount for municipal, vote an override amount for capital, and then sort of sprinkle throughout, but hopefully by the end of the night with some motions. We'll discuss some commitments the Select Board is willing to make to manage expenses, manage growth, preserve funding for capital needs, and pursue additional sources of revenue. Paris and I spent some time updating the deck. I don't know if you need the calendar, but you can show the calendar because here we are literally at the finish line. I was like, really? But yeah, there it is.
The calendar is my favorite slide of this deck.
That's why I didn't take it out, but it was like, it was out, it went back, it's out.
Because we're at the end of it?
I think that's why I was like,
It's my favorite slide.
I know that's why he wants it there, so okay.
It has no information. It just shows that the elements.
But just to sort of level set, there's some breaks within the deck on, and you have it in front of you, operating capital. We'll see if we can get the sense of where the board is. Anthea has motions that we will officially put dollar values to these various targets and needs, if that's where we land as a committee. So the official motions to put it on the ballot and assign amounts and accounts will come at the end. And Paris and I also, since Monday evening, starting on Tuesday, got some updated information from Town Hall, got some updated information from our health insurance consultant, looked at some of the assumptions, and I think Paris can maybe step through where some adjustments have been made and maybe where we want to consider some. So I'll turn it over to you.
Thanks, Michelle. So, and the board has this in front of them. So page 3 are the model assumptions that we have been using. So nothing here is new for what we've been seeing for the last several weeks, since at least January 26th when we met last. Municipal departments group at 3, health insurance at 15, WPS at 5, pension and OPEB at 3. In addition, we have $500,000 of interest income. Chris has confirmed that he's going to put $250,000 of that into the FY27 budget, as well as $200,000 of fines and fees. And Chris has confirmed he's going to put $100,000 of that in the FY27 budget. But we're putting all $800,000 through the state of the town model. That's beyond the property tax levy. In addition, we have $400,000 of turnbacks, which are effectively not filling municipal positions, because the turnbacks are currently municipal side of the government. So, you know, it's the way we budget cuts is not to wipe out FTEs, it's to simply not fill them. And so that's the $1.2 million that I think everyone is familiar with over and above our current budget. So if we turn to the next page, and then we'll get into the part that's more for discussion, is that, you know, I think we've all generally taken the view that our goal is to fund strategic additions of town and schools and to last 3 to 4 years. At least I think most of us have that view, if not all of us. 2 other data points, these are just facts. Our operating reserve figure is about $28 million. That has the long-term stabilization in it. The free cash figure is a little bit less than 22. And our objective is to keep the total operating reserve figure between 10 and 14% of our budget. And that was the policy we rewrote based on analysis of S&P, Moody's, and DLS. That's the state. And so in our last conversation, where the majority of the board was, 3 of us, was at a $10 to $13 million operating override. And that gets you, I think, you know, at varying degrees of comfort, 3 years. And only the 13 really gets you to 4 years. But somewhere in that range, you get 3 years, and then at least you can have a view of how much more it would take to bridge to 4. Obviously, we're not unified on that. That was the majority's view. We also have perspectives 8 and 9, and that's, I think, what we're here to discuss tonight, which is what, you know, potentially can we do to bridge some of that. And so I'll take us to the next page, because this is really the new stuff that, following the conversation that we've all been having with each other on the 26th, we obviously had a version of it on Monday night, and Michelle and I have been trying to chase down a lot of different things that could be done, and that's what you see on this page. So, you know, this part, I'm happy to just walk through them, but we looked at different dials or levers that the select board could use, some of which we control, some of which we control to some degree, but obviously we don't have full control over, for example, what our health insurance is going to come in at, but things that we could do to reduce the gap that we have, you know, with one another on the operating side. So I can walk through them if that's helpful. People.
I think so.
Okay. So one that we got some tighter analysis on, and then the school committee did some great work here. In their strategic additions, they had 4.5 million, is about 3.8, and then a fringe factor. They ended up finding a way to do it effectively with about 10 fewer FTEs. And that was a combination of utilizing some personnel and combining across schools, doing more through one time, meaning that they'd have a consultant rather than a full-time resource that remains to deliver some of the curriculum enhancements. And altogether, the view was, and Stephanie sent us the email, but I think there's 13 total FTEs over 4 years. And so that fringe benefit, and Stacy gave us the numbers, and we worked with Andrew and Marin on a perspective of the percent we think would enroll in health insurance, what it would cost. We took the midpoint of a family and an individual, and that can come in at 4.1 million. So credit to the school committee for finding a way to do this with fewer staff members, bringing in that fringe benefit less can reduce 400,000. I think that one is pretty straightforward.
Can we pause on that one?
Sure.
Before we move to the next number two there?
Absolutely. We should talk about all these.
Yeah, so when we're saying reduce FTE growth and strategic additions, and the school committee is saying there's maybe 10 or so that can be cut or reduced, where is that coming from? And I mean, very pointedly, is this going to touch upon the literacy or math curriculum or tier 2 support or anything else that I will say right now is a deal breaker for me if we can't fund those things?
No, they have told us clearly that their strategic additions program, the one-time expenses, and the recurring expenses, which add up. We've been talking 4.5 million layered in over 4 years. That can come down to 4.1.
Okay.
The one-time expenses did go up from that budget summit a little bit. I think literacy, for example, went up from 580 to about 8 something in the 8s, but that's one time. And then this is recurring money that comes out, right? So this and the new one-time expenses are in these numbers already. So this, they've said to us, would not touch the program that they have put forward. This is a way they found to optimize the way they're delivering, I think in particular, the curriculum overhauls. The school committee just met again like an hour and a half ago and confirmed it after we got the email. They had told it to me. Michelle had asked for it in writing. They put it in writing, and I believe they just met and confirmed it as well. And if maybe a thumbs up would be in order, if that's true.
Yes.
Okay.
We reviewed our budget.
Okay.
Thank you.
I mean, is there any other? I'm happy to provide any other.
Just wanted to confirm everything I said was accurate.
Yes.
Okay. So, again, just to be clear, whatever this FTE reduction is going to be, for the sake of pulling down the fringe cost here, it's not touching classroom support. It's not touching the strategic additions. It's not cutting back on what we're giving the kids. It's just
This number is from them, and that's what they have said. Clearly.
okay. They've given us decks in the hundreds of pages, and now we're down to one line. So, I feel I need to be absolutely clear on what this means before I can accept it. So that's why I'm asking these questions, Boris.
I've had plenty of time to talk to them. It's a fair question.
Yeah.
Okay. All right.
Next one.
The next one is health insurance. So the health insurance assumption we have baked in at the recommendation of our consultant and our comptroller is 15. This year, we got the news, Michelle, you were the one who told me, it came in at 14.4.
Yep.
So it came in a touch below. And Chris, and maybe you want to jump in on some of this as well. Maya is our insurer. Obviously, we can do some plan design changes. The select board can, and we can converge to the GIC benchmark plan, which we're slightly above right now. So maybe you want to give us some comments here, and then we could talk about maybe a lever the select board could pull here.
So we're actively, I was actually on the phone we had Ken in the other day. We were actually exploring alternatives right here in this room last week. And I was on the phone with our Maya rep, and he said my ears must have been burning because he was talking about me and he was going to call me. So he's gone back and they're trying to scrub the numbers to see if they can't make any adjustments for us now. He promised me nothing, but he promised me he would take another hard look. And I reminded him that we cannot maintain this level of increase. And they understand that, right? So we're going to continue to actively look at that and look at ways that we can, again, tweak and manage the plan, keep the employees engaged, and find ways to save money. So that's the number one priority on the benefit side. So it's a conversation that's happening, I'd say, pretty much every day at this point.
So 1% is $160,000, right? So it's a big number. It's our second biggest line item after the school's budget. And so the question is, and we don't have to debate this instant, I'll just explain it and then we can debate them all on the next page. Can we establish some kind of a policy or a process with our town manager to, review it? I mean, we obviously review it regularly anyway, but to really say this one, it hurts us so much because it's a big number and it compounds at such a high percentage. It's by easily the highest growth rate we have in the model by a factor of 4 probably, so or a factor of 3 at least. So so can we do some work there for those who don't follow these things, which is probably most people apart from those of us at the table and maybe a FinCom member in the audience. The state is contemplating pretty some changes to the GIC plan, which today were deferred by 2 weeks. That the governor has proposed, which forms the floor of what we can offer around co-pays and some other things. And if we were to not go into the GIC, that's an option too, but that's not what we're really talking about. We're talking about converging our plan design closer to the state plan and making that a habit, making that a process that we do.
And one thing I would add to that, on Monday night, where Paris is at, sort of 12%, gets to about 500,000. If we were able to get it to 11% in FY30, it's about $800,000 of savings. So people are going to come on the plan, people are going to come off the plan, but just taking 14.4 down to 12 gets us close to 500,000. Get us down to, if we get down to 11, gets us almost $800,000. So over in the cumulative last couple of years. So it is real money, but we don't get to set the rate. But appreciate that you're working on it, and we'll see what other levers we can pull.
May I ask? Please. Okay.
Ask. I guess we can go through them, maybe ask questions, but we can also I think we should deliberate on them on page 6. But go ahead.
Sure. I mean, these are all kind of background questions
Yeah, sure,
I'm asking before I can even deliberate. So the key word that you have up here is assumption. And the entire time that we've been doing the state of the town over the last 7 months, to quote you, Paris, we've been using a 15% assumption, but our insurance reps have told us that we should hope and pray that we actually get 15%, because in their expert opinion, it was going to be higher than that. In this past year, we saw 18%. Right. And now we're making assumptions.
Well, actually,
I'd like to finish my question first. That are lower, and that's contrary to everything that we've been told.
Just to be clear, this is a lever that this board should discuss about whether we want to put some kind of a policy or a guidance in place, which we can debate the validity of that. I will say on the next page, I wrote, maybe we just go to that for a second. When we look at these types of levers, some of them are easy to bank. Some of them, there's uncertainty. There's certainty, but there's trade-offs, the municipal strategic conditions. Some of them we do not have full control over, which is health insurance. Right.
And that's my point.
That's a valid, you have risk, absolutely.
But you haven't let me finish my question yet, Paris, and that's the problem. So please go back. Okay. What is the assurance, what is the confidence that we can have that all of a sudden now we're going to build a model that says our health insurance assumption is going down to 14.4 for 1 year and then going to go down further to 12 to 13% after that? I need to know, like, what is the basis for making these assumptions if it's going to have such a large impact on our budget, because it's just as likely that FY27 health insurance is going to be 18 or 25% and not 12 or 13, because that isn't something we control.
Right.
Do you want to take what we got from Ken Lombardi in terms of the range that Maya has said municipalities should budget 8 on the low end, 14.4 on the high end, that came from our health insurance consultant, published to all the Maya communities, and Winchester put itself in the high end. So we didn't say 14.4 is the high end, let's go for 14. That came from our health insurance consultant based on Maya, what they have signaled to communities. The range is 8 to 14.4. We should put ourselves at the top. That's what we've done.
It's actually 2 to 14.4.
2 to 14.
8 is the average. So what this is moving from, Bill, is from the model to actually on the ground grinding through this. So that if the board is going to charge me and the team to find other ways of reducing the costs, there are other levers we have to look at, like what are the inputs?
Can you explain that?
Yeah, it's what people pay. We have a very rich employer contribution. Now, I'm not going to start throwing around percentages now, but we have to look at all of this stuff. I mean, the fact that we were doing it in the past doesn't mean we have the financial resources to continue to do it forever. So I think we have to take a hard look at that. And I'm not saying exactly what those changes would be. If there's ways that there could be plan changes through, I can remember, Maya's provider is Blue Cross Blue Shield. And one of the benefits we have from being in this is that Maya is the largest part of Blue Cross Blue Shield in the state of Massachusetts, the largest customer. So there's levers that the organization can pull that we couldn't as an individual entity. Now, I lived this rodeo about 10 years ago when I started in Cohasset, and all of a sudden the rates went it's like, what are we doing? We can't do this. And we pulled out all kinds of stops. Winchester's done all of those too here. They understand that. When I say they, the folks leading this is a municipally run organization. The municipalities cannot maintain these levels. It's not possible. So they're going to have to look at serious plan changes too. Again, not to hurt anybody, but because we have to live within our budgeted means. I mean, taxpayers have limits too. So I don't know exactly what that is, but the charge is go and work really hard and come back with numbers because we can't maintain this.
In your past position at Cohasset, did you converge to the GIC benchmark as being proposed up here?
We never had to go to that level.
Why not?
Because our loss ratios never got that bad on an extended basis. The challenge here is that the use ratio of our insurance is very high right now. You know, premium. We're basically spending pretty much 100% of the premium on services.
More than that.
Oh yeah. So. And that has to, and again, we need to understand better why that is. Is it hide certain drug prices? Are there things we can do? And I don't know that yet. I think we're going to have to really, look really deeply at what's driving that. And are there one of the other questions we have to ask, are there other alternative providers? I know Maya has a lot of real benefits. That said, you know, we're uniquely positioned. We're literally in inner Metro Boston. And the group that we met with the other day is a plan that involves one of the major hospital centers. So, you know, we don't know that the economics work there yet, but we're open to anything that keeps good benefits for employees, super critical, but also gives taxpayers some degree of, you know, the budgeting, some degree of reasonability. I mean, nobody can maintain this kind of stuff.
But I would say, I mean, Bill, if you look at the plan that the governor put forward at the state level, that the GIC board today deferred action to the next meeting, it involves changes to cover to the formulary, basically, like what's covered. It also raises copays, and then I think the third lever that you've mentioned here is the amount of premium. So the benefits, you know, I don't want to put a metallic, you know, tier on them as Obamacare used to platinum, gold, you know, silver, but they're expensive benefits, and we're clearly seeing the compound growth of that. And so it would have to be plan design changes that would make it likely, not guaranteed, there's no guaranteed, more likely that the numbers could come down. Now, I don't think doing nothing and hoping is the strategy, right? The GIC is not implementing that strategy. And as they likely will bring their benchmark plan down, that does create space for us to bring our plan down too.
Like we did last spring.
Yeah, our rate last year was over 20%, and we ended up comparing our
14.8?
plan. We got it down to 14.88 last year by checking out what kind of plan design changes we could make. We didn't quite match the benchmark. We tried to keep it affordable still for the change for the employees with their copays and deductibles, but 25% of that savings goes back to the employees in what we call we have like a mitigation fund that will help pay for some of the cost sharing changes. So we've done, honestly, since I've been here, we've done a million things to try to keep the cost down. I won't go through the whole list, but that's something that we look at every single year is what can we do? And when Maya presented a decrease 3-4 years ago, we couldn't say no. I mean, they gave us a decrease, and the next year they promised that we would be no higher than the average, and the average was around 8%. And now they've given us an average between, what, 2 and 14.4, and they keep saying that our loss ratio is over 100%. That means we're going to be at the 14.4.
We have to be clear. Like, our loss ratio is high.
Yes.
And our copays and our deductibles are low. And relative to the GIC plan, which 640,000 people are in, right? That's the largest plan in the state, is the Commonwealth's plan, after all. And a bunch of municipal governments are in it. I don't think we're talking about going into the GIC. No. It has a bit of a Hotel California issue. It takes a couple, right? But we can converge
Bring
to
ourselves to that.
the benchmark.
Yeah, you lose a lot of control.
You lose a lot of control,
Yeah.
right?
Yeah.
So two last questions on this topic then. First is a request. Can you forward me this Maya report that gives the assumption of 2 to 16%, whatever it is, very quickly? Does anybody have it immediately?
No,
Let me get it from Maya.
From Ken.
It's the range of things.
Yeah, I just want to see it.
Sure, absolutely.
So if we have it immediately available now.
Oh, yeah, I don't know if I
I think,
can,
Bill, the question is what level of, and you should noodle on this as we continue to deliberate, like what level of number, if we're going to go below 15, which is itself an assumption, it could be 17, right?
Yeah.
If we're going to say 15 is a pretty conservative assumption, it came in slightly below that this year. If we really give the charge to town management that you have to, be at a certain number, or we're pulling out all the stops relative to the benchmark plan, does it give us likelihood that we could be 1 to 2% below 14? I'm not suggesting we should model this at 10.
No, I get it. I just need to see the support for the assumption because it's contrary to everything we've been saying ourselves for the past 7 months. And so,
Just to be clear, this is the range for this year. They're not giving us a range for the next 5 years, right?
I totally understand, and that's why I'm asking someone to forward me the
in your
document.
email.
Thank you very much. Then the second question I have is, Chris, just in plain English, because you're the one who's doing this, what is it going to mean to the staff that we're converging to the GIC benchmark? What is the actual impact on their insurance, their coverage, their benefits, their lives?
Well, we're there. We're close, right? So we're just going to continue to mirror the plan. It could
Do you wanna
change.
see
You could also increase premiums.
Yeah. So
all of us to see it, but I
right now we've been through the year. I don't think there's anything substantial at this point. That said, the formulary, this is public, right? The governor's looking to change the formulary, and the big public driver is GLP-1. It's the weight loss drugs. I did get numbers from our healthcare plan that our utilization rate went from like 90 to over like 145 people, and our cost went from $200 to over $800,000 just for that one drug. And that's just not a sustainable increase. Now, I don't know why anyone's taking them. It's not my business to know. I don't even know who's taking them. Right? We never know that level. But it's got the plan that we're in is changing it anyway, and it's limited to certain medical conditions. You can only have it for.
Okay.
They used to issue it for weight
I'm going to
loss,
kind of
but
cut to the
no.
punch here.
Yeah.
Is the impact here that there's basically less coverage, higher co-pays?
No, the coverage will probably stay the same. It's just higher copays, higher deductibles.
Okay, that's
usually
what I'm trying to understand. Thank you.
Reduces utilization, so that's how you
Yeah.
get the loss ratio to a better level.
Okay.
And there's then again, because we did it, we have to set aside money for employees to tap to
Yeah,
lessen.
25% of our savings, which is why we do an analysis to see if it's actually worth changing. I don't want to say the pain of the employees having to go through paying more. Is it worth having the savings put aside, and is it going to save us enough money?
Okay.
In the process, it's a process.
And so
Yeah.
if we were to discuss a motion here saying anytime it's above 12, we need to actively pursue plan design changes, modifications, premium changes, so we can bend the cost curve. Would that, in your judgment, empower you to go changing these? Mike, are you going to say something?
Can I answer some history? Anytime it's over 10, we already do that. Like, we already say double digits, we need to figure out if it's worth it to look at the GIC plan, to match and find out how much we'll save. Like, we do that already. And we try to actually ask any sort of question, any sort of plan. Can we add plans? Can we do this? Can we do that? That's going to somehow give us some sort of reduced rate.
And we get a more robust conversation some other night because we can spend a whole days on this stuff, right? So, but one of the challenges, and I fully understand it, if you're sick, if you're looking for a car, you price shop, right? If you're buying cereal, you price shop. If you're going in because your kid is sick, you do not price shop. You go to the doctor. Now, That said, there has to be ways to get good quality care without having to pay premium prices every single time. To the extent that we're able to bend and help work with that, Maya's already started to do some of those things. And that's one of the reasons that they've been successful, because they understand the municipal side. They've added all kinds of programs. There's all kinds of wellness opportunities. There's benefits that allow an employee, by the way, to get discounts on on sporting goods stuff for their kids or themselves. There's money in the plan to help live healthier lifestyles, and to help, go to the urgent care, don't go to the emergency room kind of stuff, right? Obviously, for routine stuff, not if something's really dangerous. And part of it is getting that educational curve.
Education, definitely.
Yeah, it's hard. And that said, I think Maya and others are getting better and better at that. And I think people are learning too. It's really expensive. People are seeing the news. How can I do better? How can I keep my family safe and also save money? Because, part of it is if the employee's paying 10 cents and the employer is paying 90, which is what I had in Cohasset with the individual plan, there's no incentive to save any money. It's all on the employer side. The tighter you get, when the savings are more shared, then there's more of an incentive. Now, I'm not suggesting we change the percentage. I'm not saying that at all. But we have to look at all that stuff. So, and we have to do our best to educate people, because this isn't just about you must pay more. How do we mitigate that? How do we find a way so that you're getting a better quality service at a better price? And in a group like mine, at least, there's 100 other municipalities all pulling in that direction. And with the state, the governor's like, I gotta do this too, because you have a state workforce, you want to maintain them too. So we have a lot of partners in this, which is helpful, and we're just going to stay very active doing that. So it's not easy, but it's something we have to prioritize. Did you say that, sir?
Yeah, I was just going to say as well, I think part of the guidance we can discuss at a future meeting may be to really focus in on investing more in the healthcare stabilization fund when we have unanticipated revenue or really extra funds around, rather than spending it right away, right? And that will help us when we have a high number that's we're not anticipating when we're in year 3 or 4 of the override as well. So it's just something that we can another lever that we can pull and commit to long term, but for a greater discussion, because I feel I hear what Bill is saying, reducing if we're increasing compensation for our employees and we're reducing benefits, it's just hitting them from a different end. And so, but in the past we've been able to really balance that, right? And we've been very committed to not reducing benefits. So that's all I want to say.
Okay. Yeah. Do we want to deliberate on this one, or should we move on them? Because I think we need to decide if we're going to do something here, right?
I mean, I'll say that this seems like a good idea, but if it's going to impact our modeling and the number that we need for this override, I need to have an assurance that we're actually going to do this before I can.
Can you define what this is?
If we're going to establish a written policy to converge to the GIC benchmark, I want a commitment by this board through a motion that that's going to happen before I can land on a final override number. Because I need to know that this is going to happen. It's so
I think
important.
that's fair, and that's where I am too. Right? And I think that I appreciate Mike's point. That's what we've historically done. That we've not wanted to impact employees that much. I think this number is eating us. Mm-hmm. It's a big number, and it is a percent growth rate that is enormous. And I think that my view is not that we should be, making active plan design changes willy-nilly, but when we get numbers,
not tonight.
But when we get numbers that are in the mid-teens, that we have to look at premium sharing, we have to look at formulary changes, we have to look at co-pays and deductibles, and we have to have a process to do that, because we otherwise won't be able to sustain. We won't be able to sustain the override. Won't be able to sustain anything. That's my view.
Yeah. Go ahead.
So one is, I just want to point out, this is not a municipality issue solely.
Yeah.
Correct.
Yeah, I mean, many of us who work for private companies have also found that in order to have our health insurance premiums, they've gone up this year, and copays have gone up. And so I think, it's not solely an issue here. Why it's an issue is how we need to manage the budget and Prop 2.5, which really limits us in getting there. The other point, I don't know. We have Mike mentioned the health insurance stabilization fund, and I think, I don't know if in the model we actually commit a certain portion. We've kind of done that as like turnbacks, but we may also want to consider, is there a certain percent or certain dollar amount that we commit into the health insurance stabilization fund to manage what 12 to 13% is a nice assumption, but it's an assumption based on, uncertainties. And so if it's going to be high, if it's 14.4 this year based on what came from our health insurance consultant, and next year it's like we just struggle to 13.8, that health insurance stabilization fund, which I proposed a large dollar amount go in, and that much didn't go in, and then it keeps kind of getting rated. Like, how can we commit to also keeping that available to manage?
Because, I mean, I agree with Mike and you that the healthcare stabilization fund is a great tool to smooth ups and downs.
That's
but you have to have the downs to fund to cover the ups.
That's 100%
and our assumption. Yeah, I agree with you, Mike. The assumption's a flat assumption in the model. Of course, in any year, it's not going to be 15.0 every year. It's going to be 12, and then it's going to be 18. And when it's 12, we should put aside 3% to cover the year that we know it's going to be 18.
We'd like it to be 4 or 5. I mean, that's what we were facing 10 years ago.
My point is not to manage the ups and downs. That's absolutely what the stabilization fund is for. I agree with both of you. This is the actual average number over a 5-year period. Can we bring that number down? If it oscillates between 12 up to 18, I would rather see it oscillate between 10 up to 16. As simple as that, right? And of course, in either case, you need the stabilization fund for smoothing.
Yeah.
But are we willing to put that on the table? We don't have to decide that this instant. We can go through the rest of these, but that's the conversation to have here.
Sure.
Okay. We can three we can maybe come back to because it's easier. 4, we had a conversation, Michelle and I believe Mike had a similar comment about this the other day as well.
Yep.
Right? Yeah. On Washington and Swanton, we have $750,000 per year of new growth in our model. That is taking a backward look at things like Cambridge Street, River Street, and then our electrical cables, not something you'd naturally think of as new growth, but they actually are quite large, that have entered the levy. We have Washington, Swanton, Waterfield. So I think the view was it's probably fairly conservative to say keeps the 750 as the annual number, and that goes up every year, but then we'll add an additional 250 because we think those buildings will come online. And so some of that was already kind of in the 750. So I think our view was 250 was a fair number.
And the other modest thing on Washington Swanton specifically, and it's the only one of the projects, I think we expect just where the ZBA is and other things, those things may break ground this calendar year. So we'd be able to levy some taxes toward the end of fiscal 28 into 29. So whether we spread that over 1 year or 2. And once we sell that property, we no longer have band payments. So I don't think we've modeled that, but we've been making some modest band payments on the borrowing that we own the property. Those costs go away.
Yep.
And those payments, I mean, they're not, relatively speaking, I mean, they're probably a couple $100,000. $200,000.
So those are gone in 27.
They are, but yes, those are.
Yeah.
Yeah, the one in 27 is less because we're only doing like a
couple months.
4-month.
Yeah.
That's on
renewal.
it's
like 70 grand.
Yeah. So we have that. So next one, and this one's bigger, right? So we had a great work stream with State of the Town. So we've talked a lot about, let me back up, about fines and fees. And we factored $200,000 into our model. Building permit fees, I believe, are the largest single source of that. Sorry, that was a question? Yes, okay. The other big category we've talked about is transfer station, and we had a lot of State of the Town conversations about this, and I see the architect of some of that analysis here in the room. So one area we can find, meaningful uplift in our revenue is the transfer station commercial rate. So this is not the dump, quote, sticker as people think about, which is not $330. This is the piece that's on commercial. It could be disposal fees beyond the base sticker, and it could be commercial volumes. And so the State of the Town group had modeled a lot of potential revenue. I think their view was commercial rates could be a big chunk, commercial volumes could be a big chunk, and then adjusting the rate card in general could be smaller, but still meaningful. And so we haven't really actioned that. And so one thing we can talk about here is factoring in, a material move in the transfer station non-residential fees into our work. And we've talked about. I have a draft motion we could talk about, but something again we've discussed kind of ad nauseum.
And that's up to 100 from what is it right now per ton?
85.
1 second.
I'm going to agree with
It's
you,
like
Andy.
175, I think.
I hope not.
Raise rates by up to 100.
Oh, raise by up to 100. Okay.
Yeah. So then, excuse me.
So I think we did 70.
194.
194.
We went up from 180 to 194, so if you go up in $25 increments or something, but getting to a higher number. We went up 15 in the last year.
Yeah, which was,
But getting on the
meaningfully
path.
less than what that group had recommended we do, right? I think they had recommended you go up either overnight or $50 increments. We could pick whatever curve we want. I'm not sure we need to pick that exact tonight, but I think if we want to factor dollars in here, what we should do is we should set a commitment that we're going to do, something meaningful, and hopefully a dollar number, and then direct staff to design the exact strategy to get there.
And Chris, you have some of those other fees as part of the whole fee table that we got you. Okay.
So I can give an idea of what a motion could sound like, or we can just keep going.
My only comment is, again, kind of with the health insurance one, I want to know when this is going to be done, so that we're held accountable and actually making something happen, so that we can rely on this as not just an assumption, but something that's going to come to fruition, because we get so busy.
The certainty on this one is much more in our control.
Yes.
Exactly. And I guess what I'm saying is I want to have that set tonight. Like, if we're going to have a staff-led team, I want a deadline for that team to give us a report so we can put something into action that actually impacts what this override needs to be in the next year.
So why don't we make a motion to launch a staff-led team, focus on transfer station commercial rates, to provide a recommendation to the board by October. I'm just looking at the date of when we discussed this.
When was it? It was October?
We voted on it on October 27th.
So we should probably get it in the spring. Wouldn't it be good to have it in the spring? May?
Yeah. Is there a staff here who knows how much time they would need to?
All right, August?
How about July?
July.
You have nothing to do in the summer.
July.
Yeah.
Chris, what makes sense for staff?
July. That's right. You're the staff.
Yeah, I put on my transfer station.
You're still new, okay?
I know, that's fine.
I say on this one, analytically, it's not that challenging in part because our volunteers have already done a ton of the work with Nick and Bob. But just make that comment.
Yeah, I think July one's fine.
Okay.
Because you said, if I recall, you reset your rates in September. Is that right?
And it says October.
We voted it on October 27th, which was maybe a little bit
Late.
later than we planned. I'm looking at Mary Ellen because we voted the residential permit at the same time, and that might have been a tight timing.
Yes, we usually always do it in the usually early October when you're setting the rates.
Yeah.
So July
But I
should be
would
fine.
love you to do it in July.
I bet you would.
So I would move that if we want to talk, we're kind of like, some were answering questions, some were deliberating. That's okay. So, I would move that we direct the town manager to create a staff-led transfer station working group focused on driving up to $500,000 of incremental revenue from commercial rates and/or volumes, and an updated review of all disposal fees, with at least 50% of that implementable by the next calendar year.
Second. Yeah, second.
Any additional discussion?
I'm always gunning for curbside compost pickup, but
I don't think that's part of this.
I know, that's why I just added it, but
Okay.
no discussion of the rest.
All those in favor of that motion?
Aye.
Aye. Okay. One thing on your to-do list, two now, health insurance,
I think
and now
we need
this
to
one.
have a growing to-do list.
Flip the page, there'll be some more, I'm sure.
What do we want to talk about? We talked about additional growth. That
Just a
one.
transfer station.
Yeah, why
Yeah.
don't we just do schools quickly? I move that we accept the reduced health insurance expense estimate provided by the school department based on the reducing the number of FTE additions by 10 roles, and that we include a 4-year strategic additions figure reduced by $400,000 from $4.5 million to $4.1 million.
Second.
Any discussion on that? Nope. I'll just move through the rest.
Great.
Yeah.
So should we vote?
Under your mile?
Oh, sorry.
All those in
Vote.
favor?
Aye.
Aye? Sorry.
It's okay.
I think I mumbled to myself
On my,
there.
I'm going to read it. People should edit it on the
Is this the
fly.
health
if you
insurance
think-
one?
Yeah, health insurance is
Okay.
what I'd written, but we can, I think there's a lot of great thinking here, so people should edit this if they feel it's lacking in some way, including Chris and Stacy, both of you. I move that we direct the town manager to create a policy for review by the select board due between Springtown meeting and the start of FY27, so it gives you sort of June, to mitigate the expense growth in municipal health insurance by setting a target growth rate of 12% or less per annum, and that this policy include a process for premium adjustments and annual plan and benefit design changes to conform, including potentially conforming the benefits to those provided in the Massachusetts GIC benchmark plan.
That was a second.
It was so long, I forgot it was still a motion.
Chris, is that a reasonable?
Thorough, you meant.
What's the time, what's,
You
can I
admitted
ask
it.
a
I
question
kinda
about the
stopped listening
timeline? So,
So let's be clear. So that would be to develop a policy. and a
Develop the policy. Okay.
Process, a number, a policy, a process to come back to us on a regular basis.
Gotcha.
And again, I think this would, what's different here is I appreciate Mike's point. We've done a great job as a town protecting employees, but I think that when we're seeing these compound growth rates be so high, I think we do have to look at things like premium adjustments, benefit and design changes. Do you really want me to repeat it, Anthea?
Can I just ask Stacy, you've likely already discussed this in developing the budget, but could you also give Chris a history of the development of the stabilization fund and how much has gone in and out of it?
yeah.
Just because, I mean, that'll come up again at town.
Yeah, there's a select board policy that we tried to stick with, but sort of failed. But anyway, yeah, we can go
Yeah,
over that.
it's even written down. It's a policy.
Yeah, it was just.
There is a policy.
And it sounds like all of us would like to use that stabilization fund more.
If we had any money in it.
Yeah.
Yeah.
Well, we
So
can find more.
We've been following the
You have to have a
turnback
good year to
policy.
put the money in the stabilization.
We've been following that part. Whatever the health insurance budget has turned back, we've been
Yes.
voting it at fall town meeting to put in, but
And
then
then
we've
take it out in
been
the spring.
sucking it out in the spring.
Doesn't lie.
But it's there. It's, we
protects
saved
it,
it.
you
Yeah,
know.
So
we
we-
saved it and we've been
We
using
have a
it.
motion, we have a second. Obviously, this is practice that we do. We're formalizing practice that we do. Do we want to have a date, kind of like generally, in the spring and the winter, with recommendations for, before the manager's budget? I don't know.
It's
do
tough
think
because-
Or
formal.
certainly before
I
spring
do-
town meeting, we need some findings, but maybe it just has to happen.
Yeah, I think you should outline a process that
Yeah.
makes
Yeah, it's
sense
fine.
given the calendar.
The process, sure.
It
We
is-
just never know anything until like November, which is always
Correct.
so late. And that's what's part of
Yeah.
the problem, is that we're not getting information timely.
Okay, so we don't need to
But-
be more specific
yeah.
on months, but we have a motion, we have a
I
second.
just want to be clear. I agree with you. It's formalizing the conversation a bit, but I do think
With more
it's
teeth.
more putting
Oh,
on
yeah.
the table premium adjustments and annual
Agreed.
plan design changes, not willy-nilly, but it's when we're seeing that growth rate above 12. Yeah.
Okay, so all those in favor?
Aye.
I called the vote that time, look at me.
We're also kind of setting, goals for Chris for his performance review.
Look at that.
We're killing two birds.
Don't think Paris and I didn't think of that when we were coming up with these. But of course, we're setting goals, our goals,
Yeah.
and his.
Yes.
I was like, yes, that's why this is on the agenda.
Is it called synergy? That's
This is why I put on the agenda, I'm like, their goals are our goals, look at us. We owe goals anyway.
And we can talk about, and Bill, I think, the first one, there's very little risk in, right? The second one, there's more risk in. We can't control ultimately what Maya. So we can, when we deliberate on the override number, I think it's fair to include, I'm going to count this as money good, I'm going to count this as 50 cents on the dollar. Like that, I think that's that's how I think about it.
No, but all of these steps are addressing some of the reasons why I have been advocating for a larger number and makes me more comfortable with a smaller number. So this is what we're supposed to do.
So Next one is municipal strategic additions, and if people, I threw it in the appendix. If you want to look at pages 15.
Sorry, did we skip all that? Oh, you went back to 3.
We were just doing some motion
Yeah,
there.
sorry.
Yeah.
Sorry.
But you want us to jump to 15?
I think it'll be easier to see it there.
That's fine.
So on pages 15 and 16, we've published, or I've printed, basically what the municipal strategic additions are. And, I think that the group was pretty comfortable. I think we were 5-0 on the vast majority of them. I want to flag maybe the ones we were not 5-0 on, because maybe that's an area we want to put them we don't have to cut them, but maybe we want to put them on a,
2 to 3 year horizon, 3 to 4
or
year
as
horizon.
resources, right?
Yeah.
Because if we didn't feel as strong, maybe that's the idea. So let's just review these. We haven't reviewed them in a bit. So the halfway down the page, DPW create an assistant facilities manager. I think everybody knows our current facilities manager. He knows a great deal about our buildings. Putting some succession planning behind him was the idea. It's not a first year one anyway, but it's something that we had in years 2 and 3. So that's one. I think the group,
taking this out.
I'm flagging them. I'm not going to suggest anything. I'm going to flag them to the board, and the board can deliberate, and I'll give you my opinion if you want it. Do you want my opinion, Bill?
I'm sure we'll hear it.
Okay.
I was going to say, Bill, you took the words out of my mouth right there. You wouldn't not share it. Go ahead.
All right. Immediately below that, DPW tree program. It's split across 2 lines. I think there was a view that that we wanted to do something here, and we accepted the recommendation of the street tree committee. The first year is 50, the second year is 150, and then it grows to 220. And so, maybe that's an area we want to level off or think about a little bit. Or we want to put some of it in the core, and we want to put some of it in that, as Michelle said, over time, if resources materialize. Next page, page 16. The young adult librarian, it's not so much that we were divided on this one, it's more that we just kind of kept it, and we never got much backup on it. So that would be one to think about as well. I'm actually not sure we formally said we were in favor of it. It was more, we just didn't remove it when we removed all the other library asks. And then the final one was rec. The additional program supervisor, it's something we did talk about briefly. Not that we had a super divided opinion on it, but I think we focused more on the community education director. And then the rec piece, from Nick, I think was good, but it was the community education director that he thought was more.
Right. Nick advocated more specifically for that community education piece. Yes, I remember that.
So if you sum up.
Cool, pause.
Yep.
Because it's been months. The community education director was the one who was going to be more involved in just building more programs at the
Yes.
rec, which then could
Generate revenue.
generate more fun, because it's one of our actual profitable aspects of town, right?
Yeah, that's right. So Nick's view was if you take his current subsidy and you increase it by $150,000,
Yep.
he could incubate programs on it, and the specific area of demand was adult education.
Yes.
And that there's massive untapped demand for it. Every time he does a class, it fills up. People talk about, Arlington and other towns that have even gone to the next level, and that he really wants to do that, but he needs somebody who can manage that.
Sure.
And that was Michelle and me, and Stephanie Minyarji was there too. Talked to him for a couple of hours.
Yeah, I talk to him every day. Not every day, but a lot. I'm at the Mystic School every day.
Specifically about that aspect.
Sure. So that's staying in. And the additional program supervisor is what in contrast to the education director?
More of a person just running, potentially shifting some of the after-school program or helping to support just some of the program that exists.
Oh, okay.
So it's kind of like it's a split responsibility, so it's adding a person to split it across another person.
Okay.
It's not a make or break of a program.
Sure.
It's managing other programs.
Okay, that's helpful to
And
know.
Nick felt more strongly about the community education as the ask. I think he told us that when he was here. So
Can I just add something? It's probably like a net cost because they pay for their benefits through an indirect cost calculation. So if we're adding to the subsidy, we also are adding slightly to their indirect cost funding, the health insurance that are related to this and other benefits.
He thought, though, that the 150 would be enough to cover benefits.
yeah,
Right, that was
yeah.
the,
Oh,
It
he
wasn't
came
like
up with that.
Employee costs 150. It was that it would be all.
That was his all in.
Okay,
Yeah.
so that's the net
Yes.
impact on the general fund budget.
That was his best.
Yeah.
And Nick has really shown us, since he's come on board, that when he says he's going to do something, he does, and the revenue comes along with it. So it's an
Absolutely.
investment in future revenue and, well, a lot of needed programs for the community that, as you said, Paris are in high demand. So makes sense.
So, Paris, inviting your opinion, did you have a summary of those, or do you want to start
The
at the
summary
top?
is simply just adding them together, right? So if you take the tree program, say it at 50, and then you level it off at 100 total, right? So 50 comes out of the next year, and 120 comes out of year 3. You take out that assistant facilities manager, you take out the additional program supervisor, the librarian small, but you take that out as well. It's about $200,000.
Can you?
People can have different views. Those are the ones I flagged with Michelle.
Could you articulate the tree piece one more time, please?
It would just go 50. It goes 30-20, right? So, sorry. So it would go to say 70-30, 70-30. So it would
Yeah.
go 50. Add the 2 rows together. 50, 100, 100.
Thank you.
So
Yeah.
so as opposed to 150, 220.
Got it.
At the risk of being more aggressive in cuts, I will hold on to my thoughts. I'm good with everything you flagged.
Yeah,
I'm not going to.
those recommendations make sense to me.
I'll say to Chris to maybe give you some relief on the facilities manager. It was a placeholder. We don't know what, Pete wants to have a person who knows the buildings like he does. If there's a need, certainly in year 2, year 3, that we need to, or there's a ramp up, ramp down. We just, in the model, didn't know that we had a time certain and didn't know that there wasn't a needed new role versus someone could ascend into the sort of professional development role. So please do bring it back if it's a need in the municipal side, but it was more about, do we have to have a placeholder versus it could happen organically or an internal candidate could fill it.
Well, I don't know. That comptroller's request is really high.
No.
I know, doesn't the clerk have something in here? Let's just go down a list.
Just training is so expensive.
You're
It's
free.
crazy.
You gotta-
Your $2,500 request. Steve.
Yeah. Yeah.
Those were some ideas I had. Michelle and I had identified areas we thought that the board had maybe was less 100% fulsomely behind. There could be others, but I just threw those out as the ones we had identified when we did the review to prepare for this meeting.
Can I ask a question? The planning department clerk, the current clerk is shared with engineering, is that correct? So it'd be adding.
Building or engineering, I forget which one.
So it would be
engineering.
taking 1.0 FTE that's split across 2 departments, adding a second 1.0 FTE. Okay. Yep. I was just refreshing my memory on it.
Is there a motion of the all?
I would move. Yeah.
Okay.
Yeah.
No.
I would move that we remove we remove the following from the municipal strategic additions from the state of the town model. The assistant facilities manager, reduce the tree program to $100,000 per year in the out years of 2028 and 2029. Remove the young adult librarian, and we preserve the adult education director, but we remove the rec program supervisor from WinRec. Second.
Any additional discussion?
I'm very happy that we're keeping some of the tree program funding in here. I think that the sooner we get that going, the better. And other than that, I'll say, from what I remember going through this 2 months ago, these were all the ones that were less documented as being necessities in the immediate. And so it makes sense that if we're going to target some stuff to draw back, it's what's not necessarily as needful as everything else that we have to take care of in this budget. So I'm comfortable with all this.
Okay. Okay, go ahead before I call it.
I'm comfortable with it.
You want taser training?
No, I would like to, if we can, the part-time young adult librarian. I know that we kind of didn't get a lot back from library on what these were, but that might be something to consider if we have a little bit more flexibility.
So why don't we make this a friendly amendment instead to my own motion? Why don't we, instead of just remove them from the model, we move them out of the core strategic additions, and we can preserve all the lines, but they're more as if funding becomes available.
Sure. And I think the manager can test that as well. That's fine.
All right. Want to call it?
Oh, yeah, so all those in favor of that with a friendly amendment? All those in favor? Aye?
Aye.
Okay.
So then that gets us to the next one, which is number 6, OPEB. OPEB is acronym for Other Post-Employment Benefits. It's health insurance for retirees. Unlike the municipal pension that we provide to our municipal employees and our teachers go to the statewide retirement system, our OPEB program covers all employees. And as a result, I believe about 2/3 of it is teachers, retired teachers, I should say.
And their spouses.
And their spouses. This is a challenging one. We, as everybody knows, I'm saying this more for the benefit of the anyone watching or here or at home. This one is something that we're going to flip once we fully fund our pension, a very large amount of money into. We have $9 million in our trust fund today. We have a liability that's about $150 million, and we have a pathway once the pension is paid off to try to fund that. Now, our benefits are what they are. The state requires you to provide a minimum of 50% plan support. We provide 70%, and does not require you to provide Plan B Medicare support. We do. So there is a gap between what the state requires and what we presently cover. And the value of that gap is about $1.5 million per year. You have that on both ends, which is to say we cover it, but then it also means we have to put away more money because the liability is larger down the line. So that's how, obviously, actuarial liabilities like this work. You have to pay more now, and then you have to you have a large liability. So this one's challenging. As people sitting at this table 12 years ago in a finance committee chair sitting 18 inches from me can recall, and a comptroller sitting across from me can recall, this is a challenging one. And so it is a very large driver, though, of our expenses, our long-term liabilities. And so we could create a select board-driven working group to examine our OPEB benefit levels. There's a lot of ways you can cut it. It could be, just for future retirees. It could be something for current retirees. It could be retirees phased in. There's lots of ways you can cut it. But is that something this board is willing to do? Potential size, is highly variable, because it's highly variable based on if any plan design changes are made. It's as simple as that. But do we have, a will to take a look at this? Under state law, the select board controls this more or less unilaterally.
Yes. I mean, I think these are all things that we need to do. And just like with the health insurance and the transfer station, if we are committing to get it done in the next year, then it's going to have a legitimate and material impact on our budget and what we need for this override. So this is another thing that brings the number down for me. But I have to know that we're actually going to get it done. And so if there's a deadline for this report that gives us time to put it into place, a change into place, and we're all prepared and willing to do that, I see no downside.
Sounds good to me.
Chris, anything you want to weigh in on that one?
No, I think it's something that has to be looked
It's
at.
the other side of health insurance. Just
Yeah.
didn't know if you want to weigh in.
I mean, you have to look at everything, right? Whether this changes on is something entirely different, but you have to at least look at it.
Okay.
And then see if there's ways to save, too, right?
And please take the advice of the Retiree Health Insurance Committee that hasn't met since it became a bylaw committee. It was an ad hoc town, well, not ad hoc, but it was a town meeting committee that met every single month just to talk about how to communicate the changes and ideas to the retiree community, which is a very difficult community to reach. So I would just hope that as part of this process that that group is included, and you can hear a report from that group hopefully when it's established again, and a report from them can come to you in response.
I believe the only current members of it are you and Michelle, because I think all the other seats are vacant.
Wait,
We're getting the band back together, Stacy.
The treasurer is also,
And the treasurer. And the
But she's not the original. She's not an OG treasurer.
I see a room full of civic-minded individuals here that we could lock the door until they
we need a
volunteer.
school, we need a school committee member, which they can designate,
I saw it.
they can either designate someone from their, I believe they can designate someone from their school committee, but I would like to just put that out there.
So that body is a creature of town meeting, right?
No, it's
It's
now
now
a
a
bylaw
bylaw.
committee.
Fair
So it's a
enough.
bylaw.
Passed by town meeting, right? I do want to be clear about this. The state law, which trumps that bylaw, still gives the authority for plan design changes to the
Oh, absolutely. This is just an advisory group
Yes.
that it would be in your best interest to hear at least their recommendations and let them know what's happening. That's all.
A
And I would
communication
like,
Communication.
I would like this to be just an avenue to explain to people that there are positions that are vacant, they're half vacant, and we would like people to volunteer to sit on that committee.
Yeah,
And
it
to see
makes
the
sense
town
because
website.
even just the mention of it will create a lot of fear and anxiety
Absolutely.
for people. We need to communicate what the objective is and how we continue to support them. So thank you, Stacy. It's a good recommendation. You ready?
So I would say if anyone in the audience is interested, you can contact myself and Susan.
Well, yeah, we haven't actually decided anything yet. But,
No, but that committee should get filled, they should.
if this board
yeah.
wants to do something,
Why don't you make, no, I mean,
I'll make a
I can
motion.
be
Okay.
back in the band, I'm all good, but why don't we make a motion that it's real?
I move that we create a select board-led working group by the start of Springtown meeting, supported by staff, to review potential benefits and premium support changes to our other post-employment benefits, with a particular focus on Medicare Plan B support and overall premium support, and that they coordinate with the retiree advisory committee created by a town meeting bylaw.
Second.
Any additional discussion? All those in favor?
Aye.
4 meetings.
They were every single month for 7 years. Well, I mean, it's, everyone is used to that
So
here.
that's
but-
the advisory committee. I think
Yeah, that's nothing compared to a lot of you guys, however.
But the key,
They
I
were
think,
very
is,
dedicated.
right. But I think the key is that we have to create a select board working group to actually analyze this,
Yeah.
the question
Do the
with
things.
town management,
Yeah.
right? And with Ken Lombardi,
Lombardi.
who may retire if we go through this one. That's okay.
Oh, he's,
Yeah, if you mention this, he's gone. I'm teasing.
So now we go on the next page, page 6. So Bill, you were getting into this, right? Some of these are easy to bank. Thank you to the school committee and fringe savings. Some of these have trade-offs, municipal strategic additions, so this board just made those decisions. Some of these we do not fully control the outcome of, like health insurance. Some of these have uncertain implementation, like OPEB. Now, transfer station, it seems like the board gave a much clearer mandate here, so maybe you move that one up. So what are we willing to commit to? What do we think is responsible and realistic? And then how does that inform, the key question, the overall operating number we have for the override? Anybody want to start to tackle those, or like me to try?
It's been plugged into the model. How would like where, or are you just asking us to do quick math?
Well, here's one way you could think about it, right? So on this page, you have 400 from school strategic additions fringe. And Bill, it's a point you're raising is a very valid one. We have no control over what Maya's going to, well, we have no direct control over what Maya's going to do. We can only use the tools we have that indirectly influence it. But maybe if you assume a point or two less, you could get comfortable at 300 to 500. The additional new growth we talked about, Mike talked about, Michelle talked about, we put 250 in. Transfer stations up to 500. OPEB will come in, but it'll come in, more likely than quickly. It's probably more likely if we make design changes that they layer in over time. I think that's maybe getting ahead of it, but highly variable at the very least. So you sum that up, you get somewhere between something around $1.5 million, depending on how much discount you apply, Bill, to the Maya change, for example, right? Because you're not going to take 100 cents there. You're going to take some discount too, right?
About annually.
These are annual, and these are like the first year annual, and then like it gets really wonky after the year 2, basically, because when you change a rate from 15 to 12, it has a huge impact. But then if it doesn't come true, it has a huge impact. Right?
Yeah.
I normally show you guys the output, but this one, it's probably just easier to sum it straight down the page.
And I think the way I would look at it too, so it's $1.5 million in 27, of which to the health insurance goes up or down, will hopefully, or stays somewhere flat, right? And then new growth is new growth. Waterfields, Washington's 250, Waterfields maybe 250, so those could be a couple. Transfer station fees and some of the work that Chris is doing on permits and stuff, like that could persist. Some of these will be 2-year windows, some of them will be spread across years, but certainly we think that there's that much for next year. That one-time fringe on the schools is where they're going to add, across multiple years.
But that's a 400 recurring, right? So,
Right, so some are recurring, but, and actually most are recurring,
These
but
are all
the Maya is just so hard to know. The rest are just, you can bank that revenue.
They're all recurring. So these are all recurring, except there's a risk in some of them more than others, right?
Yeah.
So if you go back to this page, right, I guess the question is, page 4, we had the majority of the group between 10 and 13. We had people at basically every row. I mean, not literally every row because there's 5 of us, but we had people, there's 6 rows.
The ghost.
Yeah, there's a ghost
was at
row.
12.
Yeah. We had people kind of all across this range. The majority had indicated a range of 10 to 13, right? And I think the view was, maybe I'll just speak for myself for a moment. So I was at 10 to 11 because I thought, that gets us right to the middle, kind of 12%. 12% in 3 years gets us right to the middle of our operating reserve, 10 to 14. And then we have to work hard to find that 4th year. And some of the growth that hopefully we see from the rezonings and stuff can help us find that 4th year. That was kind of my view: 10 to 11, 12% operating reserves in year 3, and then we'll find that 4th year, right? We're at 3 and change. And so if we're willing to push on all the factors here, right? And you call that discounting it, a bit. And some of these aren't going to all hit on day one, like transfer station probably gets phased in. You kind of get like $1.5 million once you discount it and put appropriate conservatism on it. So to me, that could land us, speaking for myself alone, at 9. It's one way to look at it.
Okay, so we're FY27. It starts in July 1. So FY27. FY29 is 3 years. FY30 is 4 years. Is it an accurate representation to say that $1.5 million is about 4 percentage points increase on FY30?
Let's see, 3 to no, not quite 4, but something. It's about 3%.
3.7.
Yeah,
Okay.
3 and
3.5.
change. Well, what's 5.3 times plus 7 is 12.15.
2.3, 1.7.
It's actually 3% on the dot. It's 3.05.
Okay.
3.1 versus
Yeah.
6 point.
Okay, so conceivably, if we go 9 million, then in FY30 our reserves are still below, but
Correct.
6%, and maybe we've. One of the kids was asking for a pool earlier. Literally put money on our Christmas tree this year, and every time you got close to it, money would fall out of it. So we go around like shaking some Christmas trees over the 3 years, and there are more efficiencies and things that come up. So maybe we're not at 6, or as we see ourselves getting closer to that,
So I guess my point is that unless we were going to do a $13 million operating override,
we're never.
we were not going to have that guaranteed 4th year anyway. And I think I said that on the floor on Monday, right?
Yeah.
That 4th year was always going to take work to get to, unless we were at 13 million of operating. And so, just speaking for myself, I was at 10.5. To your point, that gets you at about 6.1, and you can drop if you're willing to do all the things that we just talked about. In my view, you can drop that to 9, still be at the 6.1, And to your point, you still have to go out and find that extra 4% that you'd have to find anyway.
Yeah.
You guys should.
My math is the same as yours, but where you and I differ, Paris, is I wanted to preserve that greater than 10% reserve level for 4 years, which is why I was at the $13 million mark. But I see how this can come down a bit. And I acknowledge that there's a lot of assumptions that are built in that could go one way or the other, and everything else. I can be willing to accept this, but I need some assurance that we're not going to be put into the same situation that we found ourselves in this year again, where, if we do get to fiscal year 29, and let's say we go with what you're suggesting here, and we're at 9.7, but the next year it looks like we're going to be at 3.1. I don't want to wait till fiscal year 2030 to start up a state of the town process again. That's going to be too late for me. And Mike has mentioned many, many times about how he has a desire of having maybe smaller but more frequent states of the towns and smaller, more frequent overrides, so that we don't find ourselves in this hole again. I 100% agree with all that too. I see a big risk if we're going to go down to something like a $9 million override number, unless we also have some assurance or commitment by this board that we're not going to be afraid of talking about an override again. Because when I got elected to this board, I started to keep track of how many times my first year I said the word override versus everybody else. And I think I can count on my hand how many times other people said it. And that was really disparaging to me, discomforting. Because once you cross the line, things just get much more difficult and much more expensive. I can be comfortable going down, but...
Do you mind? So you're at 13. Are you coming to what? You don't, doesn't have to be your final answer, but where are you right now?
I would still rather be at something like 11, but whatever it is, I think that we have to establish, I don't know if this is a motion or just all of us saying it individually, we're going to look every single year during the budget summit where our reserves are and when it looks like we're going to go under 10% and need another override to make sure that doesn't happen. So we have a plan in place before we get into dire needs.
So I would say, we have been doing that. Our town manager is not creating 4 years of budgets right now and managing 4 years ahead. So,
no, of course not.
We look at that, we adjust it. The challenging part has always been, as is required of a municipality, we have to balance our budget, and that leads us to things like unexpected interest income that increases our turnbacks, that then has kind of, sort of done this thing where we have the sky's going to fall scenario, and every year the sky gets higher. So I would say, I think we do that. We can be more intentional when we move this policy up. It's going to be we've voted the policy. When this policy is 10 to 14%, it's going to be much more frequent discussing of where we are in the range, right? We're not going to be at 18% when our range is 6 to 10. We're going to be at 16% and we're at 10 to 14. And the other thing is we did vote a couple weeks ago to continue the state of the town in some fashion. So we have made a commitment to doing that. We've rightfully given everybody a little break.
Yeah, no, we all need it. But.
and their Friday mornings back. So I think you're right on, but we're kind of doing those pieces. I say we add 3, if we're kind of looking at this 1.5 and we add 3% to it, that 11 million figure puts us in 4 years at 10%. I think year over year we can adjust and look and see where we are. It would be nice to have an override that can last us a little bit longer, because this is, very complex process of what we're looking at. And to do an override every 2 years is almost like we know in 2 years we're good, like, going to do $8 million for 2 years, and we're going to do $8 million plus some level of inflation in 2 years, and we're going to do that number plus something else in 2 years. And I don't think that is what the state of the town looked at as how we're addressing the need for an override and the communication of it. So it's something to, we want to consider 4 years from now as this gets revamped. Do we just start these are the needs and this is where we're going? But I think I'm probably between you guys right now at 10 million.
Yeah, the at 10.
It's because that, in FY30 is 8, which we're going to have to do hard work between 28, 29, 30.
Yeah, I think I appreciate all the effort that everyone has put into kind of refining the numbers and making us feel more comfortable being in that range. I think 9 makes sense. I would support that. And I think to Bill's point, I think it's the right one, that we need to be committed to these policy objectives and some of this guidance, because it's easy for us to say it now and then put it out there. But also, I would like us to physically sign something, all of us, saying this is what this money is for, right? It is for the school's strategic additions. It's for these municipal ads, so that doesn't start to bleed, because we're building a budget and we're building a model and we're building more revenue, but we're building long-term trust, right? And if we're having more frequent overrides and we're doing that, we want people to say, oh, last time they did exactly what they said that they were going to do, right? And so that would be my only suggestion there, but I support the 9 number. And again, I think a lot of excellent work has been done strategically in refining it. So thank you.
I mean, I have a model that shows we could live on 8, but I'm not gonna try to argue that point here. If we're at 9, or if there's some agreement that 9 million is a reasonable number, I'm good with that. But looking at some of these same assumptions, looking at the same state of the town model, but I realize there's not a lot of support for 8 million, so maybe I'll jump on board with 9 million, because I think I think health insurance is the most aspirational of those goals, and that's the $300,000 to $500,000 goal. But the other targets are real, and we have new growth, and we have work we can do. And I'm with Mike that we should sign some things, and we should go after it. So I feel comfortable. I don't feel that there's some risk in there, but I feel like there's delivery, and we can commit to some delivery, and we can commit to going after it, and we should. So if 9 million is where Powers feels comfortable, because he's done more than any of us with this model, and he's listened to me for hours lately, I'm good there.
So psychological question: why do we love whole numbers so much?
It's not a whole number thing for me.
What? No, 8, 9, 10, 11, 12, 13.
You mean
whole numbers.
Halves of numbers?
So why?
I wasn't at a whole number before. I was at 10 and a half.
Yeah. So. So what about 9.4?
8.5.
Would you like to propose 9.4?
I'm going to propose 9.4. In fact, if I average the 5 of us, it's 9.6. So 9.4 is.
Do you want to talk? So this
yes,
is operating
I
whole.
do
This
want
is
to talk about this with capital together.
We can. That's fine. Maybe then we round up to something. I don't know.
Yeah, but it
Okay.
may not be an integer number after capital.
It may not be an integer after capital, and I don't want to vote. I'm happy for us to be in a happy place moving to capital, but I don't want to vote a number on operating before we also decide.
I think that's absolutely fair, and I think this is kind of where are people landing? Because to the point where we started, we have to fill in those numbers in that motion, and we have to think about them as 2 or 3 parts, but we're not as far apart as we were the day of the snowstorm, so we'll say that.
What, 9 to 19? What was that total?
That was the total. All right, let's talk about capital.
We have page 8 conceptually aligned on a plan for a capital override into the stabilization funds. I think we're either unanimous or close on that point. So single question. The view from the capital planning team is on the next page, so roughly 2.5 to 3.5 was their opinion. That's D to H is their view. D covers town hall, restoration, and schools. H covers the full CIP. Okay. I think our goals articulated by all of you. I tried to summarize the comments from our 26th meeting, as well as some of the comments at the town meeting, that we want to be good stewards, focus on maintenance. We want to find creative ways to partner. CPA is one we've talked about. Michelle, I think you mentioned ADA as well. There's some others.
Yep.
We want to minimize the impact to taxpayers. And we want to ensure that our process is being followed with leadership from town manager, consistent with the charter. So this one's a, candidly, more straightforward conversation, because it really is, how are we thinking about balancing these goals against the different packages, that CPC and really Workstream 2 presented to the state of the town. It wasn't just CPC, several of us were involved in it. Any other points we want to consider, process reforms or other sources of funding as part of this? So those are I think the goals the group's articulated. Sort of, we have conceptual alignment on how we'll approach it. We have some goals, and against that, we have the recommendation of our Workstream 2 group and CPC, and how do we want to think about a figure to select here?
My perspective was, I would really like to do what is option H here, the full CIP. I think that it opens up a whole lot more opportunity and problem solving in the long run. That said, I respect that it's 3.6. I think that the CPC bright line of option D is the bare minimum that I'm even willing to consider. I agree that we have to get those done, and the longer we let them go without attention, the bigger hole we're digging for ourselves. So I think I said earlier that maybe $500,000 here could really be pursued through CPA, specifically to target what we want to do with the parks and fields and everything else. So that would get my number down to about 3. And respecting a lot of comments that have been made both at the public meeting on Monday, through the many, many emails we received, and in the spirit, Michelle, I sincerely appreciate your willingness to consider a higher operational number. Like, I can be happy if we're doing something in the 2.5, 2.6 range here, something that's floating around option E right there. I think that does a lot of good and respects a lot of what we've heard from the community and everybody at this table too.
I'm going to go last since I was the very low outlier on this one, so I will hold, because I think the will of the room is not where I'm at, so I will be quiet for a bit.
I think E is the lowest. I'm going to go with this. The delta between D and E is like 140,000, a little bit less than that. I think just one consideration is when we look at those major parks, we know I love to talk about playgrounds. We're not talking about playgrounds here. This is...
They have some, Mullen and Ginn are playgrounds.
Okay. So those are not like our fields. But Skillings is...
Mullen's both, and Ginn is the playground, because the field they're doing right now through CPA.
Yeah, okay. So I'll talk Mullen and Skillings. Skillings is not going to be CPA, because it's turf. Mullen is not turf, but it's going to be a lot. So, there is, if we nudge a little bit beyond E, And we really consider Skilling's as turf, and that is not inexpensive. To do the turf over at Knowlton was a big chunk out of what we had in ARPA at the time. So, I'm, again, like, considering the balance between operating and capital, I think there is consideration for going with E or going a little bit higher than E to get some things that are going to hit us down the road. And, Skilling's not CPI eligible.
Mike?
Thanks, Michelle. Yeah, I think originally I said 2 million. It's a priority for me to get the town hall restoration and the schools done. So, I could be convinced in that 2.4 range if we phase it in. Normally, I would want to do a debt exclusion override here to fund the specific projects. That would make me feel the happiest. And when we do those large projects, there's no reason to levy the funds when we're spending a long time in ramping up to construction. So maybe if we went to D and we phased in some of that over a period of time, I think that would make sense, and it would get the projects done. Again, as I said before, we've got to commit to, if we're not going to do a debt exclusion, what this money is for, right? The specific schools, the specific projects, and town hall. We committed to electrification for this building, so it is green. That made the cost increase, and it has not gone down, right? It's just every year that goes by, the number goes up, and the building is under more pressure. So I think this is the only way to do it. I think it'd be difficult to put it out on its own for a debt exclusion override. I don't think anybody has the appetite for that. So taking care of our school buildings and doing the town hall restoration is where I'm at. So again, I think if we kind of phased in some of that 2.4, then I'd be comfortable there.
Do you want me to go next? I could go last, but I'll just kind of.
Please.
So I had said on the snowstorm, I was 8 operating and 1 for capital. 8 operating I can throw away for now. The 1 million for capital was sort of a smaller start, gets you A and B with some ADA money. We have about $400,000 in our ADA account. If we trigger, we have to get some ADA improvements and a debt exclusion for some of the bigger packages. But it's been pretty clear that the board, there's really no appetite for debt exclusion, so I'm good with that. I also realized that as Paris and I, we were looking at sort of where people were, right? And he's like, you're the only person who doesn't even have a 2 for capital. So let's just assume I'm the outlier here. That 2.4, 2.5 scope, that's where capital planning is. I'm committed to giving capital funding in this. It's about delivery. It's about making sure the money goes where we want it to go. So maybe it's Mike's written rules. It's about using it when we need it. So I think I'm going to move off my $1 million, but I think something like funding D makes sense. And then I want to hear what Paris has to say, because we've done a lot on this stuff.
Thank you. I'm going to, I think, come in right where you and Mike are, and it's not far, I think, where Anthea is either, and Bill's only a touch above that. So I think the way that I'm at 2.5. I think we're all within like 100,000 of each other, by the way. So it's pretty small differential. I think what I hear Mike saying, what I hear you saying, is that we can do something there's a variety of reasons to prefer an exclusion. One of which is the specificity of the project, and a view that people kind of know what they're voting for. And then the third one is eventually the levy drops off. But let's be clear, sometimes that's 25 years in the future, right? So we can get, I think, the first 2 of those by being creative. Oh, and then the other one, the fourth one, was Mike's point. I think you mentioned this too, which is you only draw the money when you need it, so it doesn't hit you. Like Lynch is still not even fully in the levy, right?
Correct.
Because it gets put in as we have to pay the contractor, so it takes like 3 years to get into the levy, right? So what we could do is we have 2 stabilization funds. we could say 2.5, which, or whatever the number we pick, I'm at 2.5. And we could put half into the CSF and half into the BSF. And the latter for town hall, because half of that's pretty close to B.
Yeah.
Right? Particularly if you have some ADA money.
Yeah.
And then we say that BSF share, we're only going to pull as that 12, 18 months from now when the project is designed, engineered, et cetera, right? Because then you're pulling like half now and half later, right? And then the CSF share can go into the CSF, and they can start using that for the flat work at Lincoln and Ambrose and McCall. Yep. That would be my view.
That makes sense.
I can commit to that. I mean, I'd like a little bit more for cushioning, but I can commit to that. And I think all of us want to see those projects being done as soon as possible. So
I would like to just say if we think 2.5, 2.572113 gets us, our library has roof issues, our library windows we have seen so many pictures from Capitol when they come in on those issues of library windows. I would like to see us do E. I'll put aside, we're going to have to do Skillings in a couple of years and find funding to do that because it's turf and not.
So you can
I
get.
would like us to do E.
So there's D2 that's not shown here, right? Which is you could pull library into, because if you're at 2.5, that's actually halfway between D and E, right? You could probably pull library up. I can give you the exact number if you want it. And the public safety building is like a tank, I think, and then I think the other one in here is the auxiliary fire station. Which is not actually, in fact, a fire station at all. It's a
At the
pumping
reservoir?
facility at the Fells.
Which could we do chapter
110 potentially, right? So that's the thing. There may be other sources of money like chapter 110 we could use for that, or water and sewer enterprise fund. And so library may be able to go into
You could
D.
pull it up,
to
okay.
2.5, yeah. And
Can I ask
you
a
just won't get
question?
the other
I'm sorry
ones.
to interrupt. The library, you mentioned the roof. We're doing the roof now. Is there
it's the
another
auxiliary-
piece?
It's like the
Oh,
extension.
okay, all right.
Yeah.
Thank you.
I can pull up the workstream 2 back if you want it.
No.
No,
Nobody wants that.
I think I think the temp is small.
Yeah. I mean, I would
Like no
rather
one
be at
else.
2.6 as well, Anthea, because I fully appreciate.
2.572.
Yeah. Things break, things get more expensive.
It's within 2.
This is like a Stacy slide, right? It's like down to the dollar. Right?
Yeah, talk about 10 million. Now we're talking about 2,
To the
8,
dollar,
2, 5,
right?
4, 4,
So
7.
I guess, Andy,
I was
like
asking about
2.5 to me, it's like I think Mike and Michelle were at D, right? So 2.5 is between D and you and Bill are E. 2.5 is the middle, and I think you can get one more in there, right? With that extra $64,000, right? I think you can get that.
Definitely.
Yeah.
Okay,
And
so-
could we tap the CPA for the library work?
It's parts of it, the exterior.
Exactly. I mean, I think that building more coordination between the CPC and the CPA body is going to be very important for getting some of this stuff done. That's not really what I want the CPA to be doing, but we did promise town meeting that some of those capital projects would be tackled by the CPA stuff. And if we do it smartly, that's also what we promised.
Keep in mind CPA, because of the way it's assessed on the levy. So let's say 9 and 2.5 is 11.5 million, right?
Yep.
They get 1.5% of that.
Totally understand.
Yeah, so
They
that's,
benefit from this.
So they
We
benefit.
should tag it and be like, what we gave you, we want to see back.
Yeah.
I'm not
No.
kidding. Mike says no. But Bill, I think to the CPA point, I know we said that to voters, and I think we all agree, and it would do something with the Capitol. Would it be nice as well as, I know we did some things in the first run, and it was like fields and fences and backstops, but to be like this room brought to you by the CPA, these windows, the auditorium. It'd be nice to have the banner, the CPA is doing X, that, some piece of it that you can tangibly point at, because, turf is nice. But it'd be cool to have some flagship projects that the public can look at, and you hang a banner on and you say this part, this piece, this foyer, this walkway. That'd be kind of neat. We can prove to the town meeting that that's what we did, and we can actually show it. It's demonstrable, it's public, and you're using it.
And I think that's, what you see in other CPA communities. If you're, walking around anywhere and you see the signs and you see, maybe right when we kick it off, a banner and then have a permanent sign there
Grass
as well.
is just hard to admire in its entirety.
Yeah, and so it's right. So it's certainly helpful that way. But and I think there's still money in the stabilization funds, right? So we can kind of supplement to make these work if we're close, right? And that might make sense for us.
Okay. So going back to operating.
Yeah.
Going back to operating.
Is our indication at 2.5, 1.25 into one, 1.25 into the other, BSF pulled with town hall?
I like that approach.
Okay. Indication. I'm not asking for a motion yet.
I have some.
Okay.
Going back to operating.
Yeah.
Where looking
yeah.
at, I think we could move up on operating a little bit, and I think that gets us both a little bit more flexibility into 4 years, into year 4, not having to be worried so much that we're getting to that below 10% range. If we think of, if we say 9 and 2.5 is $11.5 million. If we go to 9.4, so 11 point and 2.5, and I'll stop talking about 2.572, is 9.4. The difference in tax bill is we have it.
It's $128 per million.
So the difference in tax bill, if you have a $450,000, if your home is assessed at $450,000, your increase in tax bill at 11.5 is $436.50 on top of what your current taxes are. Your increase in tax bill to 11.9 is $450. So $13.50 difference.
You're right, Andy. If you just look at the monthly cost, right? So between a $10 million override and an $11 million override, it's $10, $120 a year. So that's kind of what you're getting at. If you take half of that, $60.
And we talk about sort of, I think in one thing we look at that average homeowner bill, and it sometimes seems like a big number, and we want to consider the tax impact kind of up and down that. If you go to homes under $1 million, the tax impact at between 11 and 12 is for 11.9 is $450,000 for a $450,000 valued home. Actually, a really nice percentage for a $650,000 home. $650 for $850. So it's actually right in line if you're at, if you're a little bit higher than 11.5. The difference is like $15, $20 annually, $25 annually, $30 annually. So I think like 0.4 million when we talk about like big numbers and whole numbers seems like a lot to an individual's tax bill. If you're under $1 million homes, is less than $30 difference for your annual taxes.
I think the way I summarize your comment is when you're talking about modest moves, right, and we have $130-something million levy, right, and you're talking about adding 10 million or 11 million to it, and if you're adding another 400,000 to a $140 million levy, it's not going to be an enormous difference to an individual. I mean, that's just reality, right? I mean, if you go from 11 million to 12 million, for example, and this is the average house, that's 1.45 million, right, which more expensive than the ones you're talking about, it's $10 a month, right, or it's $120 a year. I think I look at it less from the perspective of if you have such a modest difference of that, that it's, it's going to be your 400,000 is like $5 a month, right, for the average home. To me, it's more about the good government message that it sends of, we found. It's the balancing act, right? Of if we go too low, and there's a very articulate comment about this earlier today, the first comment, that we are setting our government up for failure, right? Mm-hmm. If you go too high, we are not giving ourselves the challenge that we sort of owe the taxpayers to go do the hard stuff, right? Mm-hmm. And so that last 400,000 is $5 a month to the median home. For a $750,000 home, that's half the median home. It's going to be roughly $3 a month, right? Mm-hmm. It to me is more about the message it sends of stewardship of resources than the direct tax impact for that very modest shift. Yeah. That would be my response. I agree with you on the raw tax impact, though.
I just think, if we go one more slide up from where you are, I believe, why are we going to struggle into 4 years versus be able to yet know we're at 4 years and be able to plan accordingly to look to the next 4 to 5 to 6 years?
I don't think that we'll struggle into 4 years. I think there's $1.5 million now that's recurring. There's potentially others that we haven't even tried. And I think, to you and Bill's point, that we'll revisit as the budget summit. We'll revisit every year. We'll make sure we don't get there, and we'll convene if we need to. I think we could live with $8 million and go smoothly through 3 years. And I don't think that $9 million makes us struggle into 4 years. And I think if it does, I think to Paris's point, it's an impetus to light a fire, to be aggressive with finding the revenue. I mean, when we did State of the Town back in the spring, when Paris and I were talking about who was going to chair and vice chair and all the things, and I was insistent that we had a work stream. Like, you love work stream 2, I love my work stream 3. We need to find, you like all of them.
I'm the work stream too.
But I was not comfortable. I mean, Bill, we heard a lot about override since you joined the board. I was not comfortable putting an override in front of voters if we didn't do the real work and real effort to find more revenue that wasn't out of the levy. Mm-hmm. And I think we have to do it. And I agree, it can get us more, and I'm not saying that another, put $400,000, it smooths it out. I appreciate that, but I also don't want to take, it's not the easy way out, but I think we should commit to doing it, because to not is, to Paris's point, I think it's not good government, and I think we need to prove that we're serious and intentional about doing it. And if we find ourselves with some bad news versus some good news, we will have time to course correct. We will have time to work with our residents. We will have time to see if there's a different lever that we can pull. I mean, maybe there's some local tax receipts that we can get. Who knows? But that's 3 years from now, or maybe it's 2.5 years from now, and we're seeing some trends. But we will have time to course correct. And I'd rather ask for a number higher than I even want to ask for, but do the work to find the revenue. That's just me.
So I just want to say, I think these two approaches are both good government, depending on how you consider them.
Fair enough.
One is not better than the other. They're different approaches.
I didn't mean to sound angry.
No, that's fair. Absolutely.
But I do want to, so the three of you had landed at 9. We've been discussing these as big whole integer numbers, and I do want to push the conversation a bit of, is a whole number, like, is that really it? Or can we be more flexible so that in 2030 we're not nearly below our current operating policy of 6 to 10%?
It's a fair question.
Or can we add?
You want to say anything? Or?
No, I mean, to Michelle's point, I mean, I was at 8 before. I feel like going to 9 is the buffer that smooths it out. And but I think residents expect us to be making hard decisions, and I think that some of those are going to come at a certain point, and we'll have to make them. And I think it puts some pressure on us to implement these strategic initiatives, and I think that is that's the assignment for the board and for the town. And so, and I think having round numbers historically is what we've been doing. I think it's what most communities do. I think it just helps to communicate to residents, that what we're doing, right? It's easier for people to comprehend getting to those round numbers. And so, that I starting to talk about something other than that. I mean, I don't know. We haven't talked about it that way before. So
for where I am, I agree with you, Anthea. I mean, I think originally I was at 11 to 12, right, when we deliberated on January 26th. I'm happy the board voted on, well, first thanks again to the school committee for the hard work on that first 400,000, but then this board voted on some pullbacks on the municipal strategic additions that were maybe acceptable, some real move on transfer station, and some serious looks at health insurance and a process there in OPEB, right? So if you take my original number of 11.5, that would get you more like 10, right? Mm-hmm. When I look at the numbers here, and in candidly, a bit of the spirit of having a board that I hope can be unanimous around a number, I do think that I look at the goals and objectives we're trying to achieve as a town, which are funding, and I agree with Mike, and I think we should talk about this at the end here, that we should document what we're trying to do, right? So we're trying to first and foremost fund all of the school's strategic additions that they have articulated to us. And if that would be, we didn't have that, I would be the first one saying no, right? One time and recurring. The second thing is the municipal ones that we really agree with, and then get between 3 and 4 years. Mm-hmm. And my view is we can achieve those things as we deliberated in December in bringing on our new chief executive. I think it's powerful when this board speaks with one voice. And so to me, the initiatives we voted on today can bridge between making sure we can achieve all of our strategic objectives of financing school strategic ads, municipal strategic ads. We haven't get this is operating with capital as well. Potentially get us 5 votes behind it. Speak to the community with one voice, and then have a list of things that we're aggressively going to attack. So that's kind of how I pull it together.
I think we're getting to just some fundamental areas where we all have different philosophies that are all totally valid.
Yeah. I think you're right.
I started this discussion with the $19 million number because that's what the math said. That's what it said we needed to solve all of our problems and give us what we wanted. And the numbers don't lie. We've identified some things today that can bring that number down, and we've made some commitments that give me assurances, and that's great. But I think where we are right now is just kind of how, I don't like using the word conservative, I don't like hopeful or skeptical, but
risk. How much risk?
Exactly. And I am so very risk averse. And I know that we have a lot of dedicated people at this table, in this room, in town meeting, across the town. But the likelihood of something going wrong is always there, out of our control. And that's where I get inspired for a larger number. Because just because we pass an override doesn't mean people's taxes go up. Just because we pass an override of $15 million doesn't mean we are pulling another $15 million. This point was made by a few people, I think, on Monday night, and it's, I think obvious to a lot of us wonks here, but it's not obvious to everybody who's necessarily voting. I see passing the override as giving us kind of an insurance policy, giving us an opportunity to do something. But those actions, that spending, still has to go through town meeting. I would much rather have the opportunity for us to do something when the emergency comes around and not need to, resort to another immediate override or other sorts of emergency actions. I'd rather see a larger number on the override and then not necessarily need it because we're doing everything that Michelle is saying that we should do and finding that revenue and being strict about what we're doing with our spending. But if something goes wrong, we're not up the creek without a paddle. You know, and that's why, like, you know, I've come down, I can see it, the numbers are working with these other things, but like, I'd still like to see something that gives us some good assurance that we're going to get, you know, to 3 years with little worry about staying over that 10% line, and hopefully to 4 years with something better, and that we're staying vigilant the entire time, not just on how we're spending, but on how we're getting ready for the next time that we need to pull these levers of an override. So I think that we could do an override here where we all agree on a number that's like 12.5, but we're not pulling 12.5. We're actually spending where Michelle wants to spend, but we have that backup and we have that insurance in case something goes wrong.
I will not support 12.5.
So I think that if so the first sentence on there is I think a key one to me. And I've said that sentence out loud, I think like 150 times in the last month, right? And all of you have too, which is our goal is to fund the strategic additions of the town and the schools. So that's level services plus the strategic additions, and last 3 to 4 years. I agree with you guys, with Andy and Bill, that if we said, and last 4 years, that we should do a little more. Mm-hmm. Because with that extra 1.5, and there's error rates in the health insurance, but I think we'll get something from OPEB too as that rolls in, you know, and we'll make some changes there. I'm committed to it. At 9, which is really the equivalent of 10.5 million, so that's like 6%, and Andy, you did the math on that, like 6.2%. Mm-hmm. That to me is 3 to 4 years. I mean, I've stood up countless times and said, we're going to get to 3 years in a bit. I don't know if it's 3 years and 3 months or 3 years and 6 months, but something like that. Not 3 years and 6. It's not 3 years and 9 months, that's for sure. And we're going to go out and find that last 6 to 9 months. How many times did you say that? Right.
So many times.
Yeah. So that's kind of where
but you're not wrong.
Can be comfortable that if we had decided as a board we were at 4, I would agree with you guys. But since we said 3 to 4, kind of in the spirit of that was our design principle, we can still fund all of our strategic additions of town and schools. It should be documented, Mike's point. And we should talk about that tonight. I agree with you, Bill. It comes down to how much risk we're willing to take to get to that 4th year. And numerous times now I've stood up and said, we are going to get to 3 years and a quarter. And we're going to have to go find that last 3 quarters. Mm-hmm. If we said we wanted those 4 years definitively, then I agree, but I've never said that, and I've never represented that view to, at this point, lots of town meeting members in the public.
Yeah, I have. So then that's where we're dividing ourselves.
Yeah, I think our interpretation of the phrase "last 3 to 4 years" is differs, which is an awkward thing to say, but things have been decided on the placement of a comma. I think it's easier to talk about round numbers. 4 years is easier to talk about a round number. But I think
I like round numbers. Sorry.
Everything contradicts itself, including me. But I have had the same eye as Bill, as if we can get to 4 years, if we can get to 4 years and over the course of the next 4 years determine that we actually have gotten to 5, I think we're in better position than if we can get to 3 years and 6 months and get to 4 years. And so that's why I'm trying to push the discussion to increase us a little bit and work with that uncertainty and risk to have our, basically to have our schools, our municipal staff, our services, our potholes, right? Because we're in the middle of December or in the middle of the winter, roads, to have those things in a position that we're getting to 4 years on that and thinking between year 3 and 4, that is what's the approach for the next year, and not spending the time between 3 and 4 going, where is the money to make it out of this year? So I think Bill and I are looking at this in kind of the same way that's different from how you all are, and that's why I'm just trying to nudge a little bit on what we do.
Well, I think you guys are saying 4.
Mm-hmm.
I think Michelle was saying 3, but has moved up a bit. And I had always, and again, I've said it on camera umpteen times now, always seen it as 3 to 4 years, somewhere in the middle. For what it's worth, that is what the 19 override discussion was, 3 to 4. But not saying we have to do what they did last time.
So, yeah, I mean, the only thing I'll say, I mean, I still think that the 9 and the 2.5, I think those are the right numbers here, and I think it gets us to 4. I'm fairly confident with that, but there are always things that are out of our control. When we're looking at taxpayer impact, I don't want too high of a number to impact a potential Morocco construction. I think that's a priority for the town. We've been approved for partnership with the MSBA. Along with those school projects, and I know I'm going to make Stacy uncomfortable here, when we borrow money for them, we borrow them that money in advance, and it sits there and it collects interests. We had sizable interest coming from Lynch. We don't expect that to necessarily be as much for a Morocco project, because Lynch was a little bit longer, but there's still revenue there, additional revenue that we're not counting. So there's things that happen that are good and things that happen that are bad, and I think the 9 gives us an opportunity to smooth things out a little bit around the rough edges. And the other thing I'll say is, just to really finish up here, it's getting late, but just to say thank you to Paris and Michelle and the State of the Town Committee. This was an exceptional effort. The amount of time by the committee and everyone involved and our staff is unprecedented as far as I'm concerned, and it creates a model for us to be looking at things long term and to be focused on it in a way that we never have, really getting under the hood and pulling all these levers to be as strategic as possible. So I'm confident with that effort. I trust Paris and his numbers. If he's okay in that range, then I'm certainly there. But I think that the success of the state of the town is the success of this override. And so I'm extremely optimistic about it, and we'll be funding what families have been asking for as far as strategic initiatives in our schools, and funding our teachers' compensation, funding literacy, funding math, Tier 2, all of those things. I look forward to continuing the discussion, but just more formally, I wanted to thank Paris and Michelle, the State of the Town Committee. It has been exceptional and really the gold standard as far as I'm concerned, and I've been sitting here for a long time, so thank you.
Thanks. So we're really close here, right?
9.25.
You're at 9.25?
9.2 and 2.55 for capital. I look, this side of the table is trying to get us as far as we can into year 4, and that is why.
And this person wants an override to pass, and I think the higher we go, the more risky that is. And what we need now and what we need for 3 to 4 years is, perhaps it's a lot to ask, and I think it's a fair ask of residents who may or may not live here in 3 to 4 years, and our needs may change, and we don't know. But I understand the risk, I truly do, and the comfort or discomfort with the risk. But we're asking people now to give us a lot of money, and then we're going to say we want you to give more money just in case we're wrong. I'd rather be wrong, or I'd rather work hard at being right than ask for more money. 11.5 is my number. I'm really not prepared to go above that. That you only need 3 votes to put a ballot question on.
So can we talk about that? I voted, as that bracket shows, indicated by a majority, of which I was in, for a number between 11 and 12. we did a lot of work today, so take $1.5 million out of that. That's 10 versus the 9 we're talking about today. But I do think this board has not gone out with 3 votes on overrides historically. And I think that there is value in this board speaking unanimously. And to me,
Yep.
it was important when we hired our chief executive officer that we had 5 people to support him. And it's I'm not going to say it's the world's, it's the end all be all, but given the tightness of the range that we're in, it would be, to me, valuable.
I think,
you should
no,
keep
I
talking.
just,
You guys should
I
keep
mean, given the tightness of the range that we're in, I think there's consideration of where is, flexibility to change. If you have a $2.65 million house, if we think about the ways we communicate these things, the difference between an $11.5 million override and $0.75 million override is $53 a year. So what, like, we can be in consideration of the tax bills that we're instituting, but I also want us to be in consideration that as we go up small increments that help us move forward through year 4, we're not, like, the change at lower values is, the change as you're under the average is quite low. So I just, I want to throw that out there because we were asked to say, what are the tax rates and the tax bills, and we look at that for the average single-family home, but thinking of the totality of people who own homes here, it's, we don't have that on the chart. I just keep doing math over here.
But even for the average, I'm not again, I was net of this $1.5 million of what I consider $1.5 million that we talked about with these motions. I was $1 million higher, right? To me, you're right. There's no question when you're talking about anything under that, $250,000, $400,000, and you look at the tax impact table, it's not going to be large, right? $500,000 on the median, the average home in this town is going to be $5 a month, right? Mm-hmm. So you said $250,000 would be $2.50 a month. Mm-hmm. Obviously, that is a relatively modest, differential. Because again, you're talking about a $135 million levy. You're talking about adding $10 or $11 million or $12 million to it. So that last 250 is not going to be what makes or breaks someone's film. It's to me we've challenged ourselves. I agree with you. I was in that majority, and probably if I was the only member of the select board, that's what I might put forward, right? But the value of unanimity to me is worth something. The perspective of I didn't mean to imply earlier that it's not a good government approach to go higher, but that we're in the realm of where it's just a balancing act between what we ask people for and what we challenge ourselves to go find. Given that those core strategic objectives of Mike said it, Off said it, we all said it, schools and town strategic additions are all achieved, and our critical capital is achieved. That's how I come down on it. But I don't disagree with you that if you add $250,000, it's $2.50 for the average home in this town. That's a mathematically true statement per month.
Mm-hmm. And I don't think residents experience it that way. I think it's more of like death by 1,000 cuts, right? That, your water and sewer bill is going up, the transfer station permit is going up, your, athletic fees are going up, right? And, it's, and so those increments matter, but it's not just, downsizing your latte in the morning will cover all of these, these expenses. And so, again, I'm confident in the number. I think to Paris's point, it makes sense for us to, all be aligned here. So I hope we can get to that number soonish. I think we're close.
Chris,
so you could say, Chris, find me another $250,000 in savings and revenue over the next 2 years. I mean, I'm not pledging that I can find it, but you say,
Chris, find us another $250,000 in revenue.
But the second half of your statement is what I'm worried about, and that's the thing. And when it comes to all these points, they're all good. they're all valid, they're all rational. Nobody is wrong at this table right now. I've already expressed like why I'm looking at the numbers I'm looking at. But the things that have come up since I last spoke, we are also, I understand, committed to a residential exemption. And, that is also going to impact, in a good way, the people who do have the more difficulty to pay on these things. So that the death by 1,000 cuts that Mike is worried about, I'm worried about it too, and I'm committed to solving it through that residential exemption. And those are the people who, more than anybody else, need a well-funded, well-run government to help them with the benefits that they're going to get from what we're funding through this override and everything else. To me, that's the purpose of government, and to make sure it's done well and efficiently, which is where I agree with Michelle. So now, I guess the number I'm looking at is 9.5 plus 2.5. And I think that is a workable number. It is far less than I came into this process at. I think it is a number that is going to be accepted by this town. It is a number that we've seen other towns accept. We're seeing Arlington put forth a $15 million override just 2 years after a $7 million override. And I think it's workable. I think it demonstrates a consensus where we have all moved and we have all recognized our points in this process. I think it is one that solves a lot of problems, that is going to demand that we continue to work hard to find revenue, to find efficiencies, and to make the things work, but also manages risk in a way that is truthful. Because I'm just so concerned and as positive as I can be that something bad is going to happen in the next 2 or 3 years financially, not just to us, but to the country. And I want this town to be as well prepared for it as possible. And we've already discussed and I think committed to not necessarily pulling this full number right away, as we talked about the capital aspect of it and getting the town hall money in only in a year or two's time when that project's actually rolling around.
So I know we like to talk about Arlington. Is it 14, 17 million? So I forget.
14.9.
14.9 in a
It's
town,
a minimum 14.9.
a town of 44,000 people and an average tax bill of $11,947. We currently sit sixth of our peer communities with a tax bill of $18,272. At 12.5 million, so if it was 12, $19,460. So we'd be solidly $8,000 above Arlington.
Sure.
At a 12.5 million or 12. And Arlington is not a comparable. I mean, that number, whatever their number is, will be spread across twice as many people, and they're already 30% lower than us. So to go higher and try to take Arlington as the peer, it doesn't really work.
No, but we'd still be lower than Wayland, Concord, Andover, our Lexington. Our pure per pupil spending is also dismally less than others in the state. It's, we can compare a lot of different things. And yeah, I just compared us to Arlington because I just think the way that they handle this is very prudent.
I would completely agree with you that we need to give the schools the resource that they're seeking, right? And it's come in to a little bit under $1,000 a head, $4 million, 4,300 students, plus level services, and they've done great work there. I wouldn't support it if I thought this wouldn't fund their needs. I'm with you.
No one thinks it wouldn't fund.
I agree.
I mean, everybody, this is about the last 6 months or the risk in 2029 or something before 2029. But we're in today. We're asking voters to believe us today and in March. We have a path to all of the things being done. Horace and I agreed on where I said on Monday that there's $1.5 million. There's $1.5 million. There could be more. Local receipts, if you just take out the transfer station, we found $100,000 in building permits. We only thought we'd find $200,000. Do I think we can find it? I do. I'll eat my words if I'm wrong. If I get reelected, I'll be here in 3 years. You can tell me and throw it in my face that I missed the mark. But we shouldn't ask for more than what we need.
So Arlington's levy is, I just pulled it from DLS.
10.7?
That's the mill rate.
Oh, the full levy,
That's the mill
sorry.
rate. The actual quantum of residential taxes collected, resi, is $162 million. So let's assume their select board, which is literally meeting right now, talking about the exact same thing, by the way, picks 14.9, which is what their long-range financial planning committee came up with, which, by the way, is their permanent state of the town.
Yes.
Never stops meeting. That's 9.2% is likely what they're going to put on the, if I had to guess, it's what they're going to put on the ballot. That's the minimum they've articulated. The resi share of our levy is 124. 11.5 is 9.2%.
Same percent?
And if you, Anthea, you wanted 11.75, it's 9.47%. So we're right on top of them as a proportion of the residential levy.
And the reason that the bills are higher, and I think someone said this Monday night,
Valuations are higher.
is our home values are
valuations.
higher. We have, Arlington has many more smaller single-family homes and condos. So, it's hard to compare those. I think, and home values have gone up and up and up and up. Everything has gone up and up and up. Things will continue to go up and up and up. We got hit with Lynch with like tariffs on steel or something coming in right off the bat. That's going to happen again when we do, who knows what project down there is going to have something. So
The unknown unknowns.
lots of, yes, there's a lot in that quadrant. What you don't know, you don't know.
Do
So
we want to take a vote?
we could, I mean,
You don't look like you wish to, but
I don't think I wish to, because I do think that, part of my whole logic here is trying to get this board to a number, right? And so it seems like we actually got there in capital, which is the one I thought we might have a larger spread on, candidly.
Do we want to vote on that?
Sure. No. And we have to vote the question at the end anyway.
yeah.
So what we do, should we?
We're 2.5 hours in at this point, so
Right, okay.
unless we want to schedule the state of the town meeting in the morning,
It's fine.
then we got to.
So
I would argue we're 8 months in.
I move that we support a capital override of 1.25 million into the building stabilization fund, 1.25 million into the capital stabilization fund, with the understanding that the building stabilization funds will be drawn for the use of town hall as needed. We will bring those articles to town meeting as needed, and that levy will remain uncalled otherwise.
Second.
Any additional discussion? All those in favor?
Aye.
Do a roll call vote.
I can do a roll call vote. Bill?
Aye.
Anthea?
Aye.
Paris?
Aye.
Mike?
Yes.
I vote yes.
Thank you.
Because I think we can't put quite that much detail in the actual ballot question. Right. That's
Yeah.
Okay.
Yep.
Anthea has the wording for that.
Yeah, I do have this.
Yeah, it's also here.
Yeah, you have it in there.
At 11.5, we're at it's a 9.2% increase in our levy once fully implemented. Again, interestingly, right on, I'm surprised by how it's 9.27. If Arlington Select Board picks 14.9 out of 162, it's 9.2, 9.19. So ours is like a tiny bit higher. At 11.75, we're at 9.47. So we're again a tiny bit higher than that. We're right there in terms of what a peer community, as we speak, is doing with this.
Yeah.
It's hard to disagree with the view that $250,000 makes a small difference to a taxpayer and does help us get somewhere closer to that 4 years. I'm going to stay where I am, not because I disagree at all, but just because if the goal is to fund strategic additions of town and schools, we can get there. If the goal is to last 3 to 4 years, and as I've always said, it's somewhere between 3 years and a quarter and 3 years and 2 quarters, I think it gets us there with all the other things we've committed to. And I would like to see us be unanimous as a board. That's kind of where I am.
This is a point in where no, again, nobody is wrong here, but we are so close that in all the mediations I do, usually the mediator steps in and does something called a mediator's proposal. It really, all it is splitting the difference. And if Michelle, if you and Mike are at 9, and Thea and I are at 9.5 or so, 9.25, if it's unanimous and we're committed to everything that we have discussed tonight, and you know, it's the 5 of us right now, which who knows who's going to be at this table in 1 year, 2 years, or 3 years, which is also one of my concerns. But if we can be unanimous at that middle, I mean, I can't think of a better demonstration of consensus in working together than doing that. I will support that.
So I'm still, at 9, and again, I mean, I appreciate the reasoning. I really at 8, I'm going to 9. That's kind of where I'm meeting in the middle, and so and I trust Paris's math, and he's lived with this model and these numbers for several months, and so I trust that, and I trust our management, and I trust this board's commitment to finding revenue and to landing the plane, and so that's where I would like us to be.
So my math doesn't tell you where you should be. It just tells you what the numbers are, right? And
Yep.
and I guess to go back to that first sentence, which is what I've said to people that we need to achieve. I think that's what Mike, you were saying, which is that we can do the strategic additions for the town and the schools,
Yeah.
right? With 9, I believe we can. With all the stuff we talked about, with the transfer station rates, with the OPEB, with the municipal, the health insurance work, and again, thanks to the school committee on the school benefits for the expansion piece. I've never pledged that we are with this number with no risk getting to 4. I've said 3.25 to 3.5 years repeatedly, and I believe that's where 9 gets us. I agree that extra 250 buys you another couple months. An extra $1.5 million gets you pretty solidly to 4. To me, I've said 3.25, 3.5, so I'm comfortable at 9, and I prefer this board speak with one voice.
I mean,
The question was more to you and Mike.
yeah, that's fine, but I think it's, $250,000 for what might happen in 2030.
Exactly.
We can do better. We can expect that we can find, like Chris, find us $250,000 in the next 3 years. We can do it. And why move up?
Yeah, but that is cool. No, that's a little bit glib, but I just think I think Paris has done considerable amounts of work to look at where we are, what we've done, to make these changes that we've made. And I mean, we're talking 6 months, and so I think that's
Paris didn't just find that money. We
No.
worked a lot this week.
I didn't say
to
he
find
found
that money.
I said he has done considerable amounts of work. After tonight, basically everybody in the audience owes him a drink, if not a cup of coffee. But I think I worry the position that we're in going into FY 2030, and that's not, it seems far away, but that's not that far away.
I don't know how to say this other than what I'm about to say, which is I don't want to be on a 3-2 vote right now. If somebody calls a vote, I'm going to abstain, and it's going to deadlock 2-2. So I need us to try to bridge this somehow. I've said where I'm comfortable. I started higher. I'm comfortable with the lower number. If anyone's willing to move, please try.
It is clear to me that multiple people are not willing to move. It is
for $250,000 out of a $130 million levy going to a $140 million levy.
which makes us all sound kind of ridiculous, the five of us.
I mean, the levy is literally $124 million right now. If we add 11 to it plus Prop 2.5, that's the Resi levy, I'm sorry. The overall levy is even bigger. It's like, Stacey, you know it offhand?
No.
131 plus Prop 2.5. I mean, we're talking about 0.15% differential in the levy.
We do this on free cash during town meeting too, and
But I don't do that about free cash during town meeting.
town meeting does this about free cash.
Well,
during
we're
town
not town meeting.
I know,
we're supposed
we
to
are-
be focused on the.
So in an effort not to behave like town meeting, and
That was 131.
That's why I said 131. Yeah.
I think we've spent over half an hour trying to rationalize the course of 6 months. And, you know, no one's actually, like, there's this fear of like pushing forward. I didn't make a motion that we go to 9.2, that people seconded or didn't second or whatever. We also haven't had a motion for 9. So I don't know where you are on. I know where you are.
I've made my suggestion. I started at 19 million. Nobody has moved more than me. And listen, I don't see the problems going away unless we address them and face the hard facts. So I feel like I've given a lot here, and a lot can be achieved with this, and I am where I am.
But Bill, so the majority position of this board was 12.5 to 15, exactly. So, and I think if you took the average of the two of you, it was 10. Yeah, it was
I
10.
was actually, yeah.
Yeah, it was 10. Okay. I think you were 8 and 2. You were 9 and 1. Okay, so you're 10. So if you took the midpoint of that of 12.5 and 10, it's 11 and a quarter. So it's slightly above that, because there's 3 people slightly above it, and there's 2 people below it. So actually, on a perfect weighted average basis, it would be 11.5.
Great.
But that's like just the will of the collective, right? So.
Motion.
No, but I would like us to. A big part of why I've moved too is to try to bridge this, right, with one view.
And I'm not making a motion until, you know, in respect for how much that work that you've done until we're ready. But I don't know if that's going to be midnight. And, you know, I'm happy to. I want people to coalesce around this.
For what you hold.
I might hold. We've given up a lot here.
But can I push on? So we've given. I would, Bill.
No one's losing anything.
I go back to the first sentence on that. I wrote that there for a reason, which is our goal is to fund strategic additions of town and schools. All of our critical strategic additions on both sides, really all of the strategic additions the school committee asked for, are funded. We're between the 3 and the 4. We did it through this board agreeing to do some great work, I thought, tonight, right? Health insurance, Maya's, tough work. We agreed to do it. Municipal strategic additions, that was a little bit easier. Transfer station's not going to be an easy vote either, but we did it. OPEB, we said the words out loud, and we got a group formed, which itself can create some scrutiny. Schools, thanks for your $400,000, because we didn't do anything for that, but we'll add it. So we moved for good reasons. We didn't cut anything, I guess, is the way I'm looking at it.
You're right that we haven't, I agree with you that we haven't cut anything. We've taken some of the municipal strategic ads and bumped them down or moved them out based on discussions.
But I would argue those were never strategic objectives of our town, like the way that sustainability or rec, right? I mean, these are how the health department, like we didn't, our COA, which we haven't talked about at all tonight, and the Jenks Center lease and the idea of a translator, that's all still in there. Planning board's asks are all still in there for a municipal zoning bylaw review consultant and a update to the master plan. The Morocco feasibility is still in there. I mean, that's what I look at, which is, there's nothing I look at that I'm like, we left on the cutting room floor that I really wanted.
So I'll say this. Paris has said over and over, and Mike said as well, and Michelle said, it is on Thursday, on Monday. On Monday, we were very far apart, and we were not close to any numbers that would get us a unanimous vote. There is, important approach to being able to say that we voted unanimously on this number. I think in some of us wanting a higher number does not mean that we don't want the lower number. This is just, can we move that lower number a little bit more and move us to the right a little bit more? And so I think I have 2 kids. They were here. They're not getting a pool, and they also better be in bed by now. They were here. You all have children, and you know that at some point you give them the remote, because this conversation is going nowhere, and whatever it is, you got to go cook dinner, and they won't quit. So I will give you all the remote. I will and go down to the 9 so that we can get towards a unanimous vote. But I think that's also on Bill. If you may not be overall in favor of us doing 9, are you in favor of us overall putting out total $11.5 million and voting unanimously that
that's a good idea. What, could you vote no on the 9 right now, and then when we vote the whole ballot question, vote 11.5?
I'm not going to answer that question. I'm going to make a different suggestion. Okay. Because my concern is, again, more than anything else, the risk that we're facing over the next couple of years. And I see so much of that coming from health insurance. And the numbers from Maya do look good. And the Health Stabilization Fund is a very smart thing. In our modeling, we have modeled the idea of pulling 70% of the override in the first year. If we could pull more than 70% and put that into the Healthcare Stabilization Fund to manage that risk that could come from an uncontrollable shock, that would address my concerns and allow me to agree to 11.5. I mean, that is exactly why we have the Healthcare Stabilization Fund. And that gets us a unanimous vote. And it addresses the risk that has got me concerned here.
I'm going to just try to come back to you really quickly on the 70% point. I modeled 70% from a tax impact perspective, because I kept saying I don't want people to say, oh, town meeting spent more money and my taxes went up more than you claimed and the select board misled the community. I made that deliberately conservative. Mm-hmm. I'm going to look at the model right now and tell you what we actually need to pull. Mm-hmm. And then we can talk. Why don't we talk about that? Because I don't think it's 70 is my point. I think it's actually less that we actually need to pull in year 1. I was just trying to add extra conservatism to it. But if you want, I don't know if you guys want to talk about that. But.
If we put it into the Health Insurance Stabilization Fund, for some, if it's a $2 million number, I'm not sure what number you have in mind, but maybe that's the risk. It's a 2/3 vote of town meeting to take it out. It's a 2/3 vote to put it in. Yep. It makes it's only for health insurance, so it doesn't solve school needs. It doesn't solve all the municipal things. It's a buffer for a very specific line item in the budget that I think puts other items at risk. So I don't think it's the safest bet, and I don't think it protects us 3.5 years from now. If we bake $2 million or some number in the Health Insurance Stabilization Fund, we just starve other places. I understand that we need to maybe find a way to feed that fund, but I don't think pulling in the override and leaving it there to only be appropriated at town meeting by 2/3 votes I think that's a much riskier proposition than asking the town manager to find $250,000 over the next 3 years.
I think we'd pull about half the override, by the way, in practice. If we did what's in the model, I think we'd pull about half in the first year. So 70 was a deliberately conservative number. If you want to fund healthcare stabilization, you can go slightly above half, right?
Yeah, and I mean, I appreciate your point, Michelle, and that would be left at town meeting, just like every other aspect of our budget.
So I guess that's the reality, which is what are we even proposing? Because town meeting is going to be the one who makes that decision about whether or not they want to, let's say we need
Correct.
let's just say we need $5 million from the override to balance the FY27 budget. And you want to pull down an extra
5.2 or 6 million.
6 million. Let's just say you wanted to pull down an extra million. That's a town meeting choice anyway, which FinCom, I think, would bring. So is your proposal we could bring it to, fair point. I think we actually have brought it.
We have brought it.
Yeah, we actually contingent it last time. Is your proposal that the select board agree to replenish the healthcare stabilization fund from the excess levy for up to some dollar number? Yes.
Yes, and if we can agree to do that, then I'll agree to the 11.5.
There's a lower range in the policy. There's an amount that's calculated based on the current year's health insurance budget.
Which is like, it's 2% of the budget, so it's $280,000. 300 grand.
I think that's
okay.
You know, when we created those the Special Education Reserve Fund and the Healthcare Stabilization Fund, I mean, it was to manage that risk, that was that we couldn't predict. It wasn't to fund it out of the levy directly. I mean, so that's my concern. That's not how we communicated it. It was when we were over projecting on healthcare, and then numbers came in lower, and we made a good rationale for not returning that to free cash, but encumbering it for future years. So if we get to a point where we're on fumes from a previous override, we could make it happen without cutting healthcare, making plan changes without cutting the schools, and we always saw that as an investment in our employees. And so I just there was a concern when we created it that it would be a slippery slope and that we would start doing this, right? And so that's my and that's why it took us a little time actually to get it approved from town meeting. They did not like it, so that's my concern.
So how much is in
they
there
can
right
just
now?
$80,000.
80? Is it
72,000.
I think we used 70 in our proposed FY27 budget.
I think you've used it, but as of we sit here today, I think it's about $72,000.
FY27 is going to be empty.
So it's going to be gone.
It's going to be gone, yeah.
So I think, I mean, it's going to be problematic when it's gone.
All you're doing right now is you're making you could make a motion to direct the town manager to include in his budget an appropriation into the healthcare stabilization fund consistent with our policy, and that is something that town meeting will decide on ultimately. It's not even our decision. It's just you're right?
I think there'd be consensus around that, right, Michelle? No? Yeah. Michelle
Does that
agrees.
work?
That works for me, and I mean, is the rest of the board going to support that idea? Or are you guys just saying this to get my number? No, it's legitimate. Like, I don't want to go to Springtown.
If we say we're going to do that.
Say you're going to that the board's sponsoring an article.
Yeah.
Right now.
If that's what we're going to do, that's what we're going to do.
We're going to sponsor an article in the spring warrant. Just make the motion.
I make a motion that the select board sponsor an article in the Springtown meeting warrant to
replenish the health insurance fund to the baseline level?
Baseline.
To be consistent to the policy level.
Policy baseline.
If the override passes.
If the override
passes. That's the motion. That's the second.
Yep.
All those in favor?
Aye.
Aye. Okay.
We sponsored the article just now. So
I make a motion for a operating override of $9 million.
Second.
You want a roll call vote this
I
one,
do.
Mike? Okay. Mike?
Yes.
Horace?
yes.
Anthea?
Yes.
Bill?
Aye.
I vote yes. I almost called myself Michelle.
That was easy, right?
Now we need to fill out the ballot.
Boring parts?
This should be the easy thing, though.
Okay. I move that the select board sponsor or place on the 2026 town election ballot the following question, reproduced on page 13 of this deck. Shall the town of Winchester be allowed to assess an additional $11,500,000 in real estate and personal property taxes for fiscal year beginning July 1st, 2026, for the following purpose and the following amounts? Funding the annual operating budget in the amount of $9.5 million to be used to pay for police, fire, library, school, public works, and other municipal personnel.
Wait, I'm sorry, $9 million.
$9 million. It's very tired. And other municipal personnel. Thank you, Stacy.
I saw what you did there, Paris.
Yeah, Bill and I were secretly for other public safety, town, and school expenses, and funding the capital stabilization established under Chapter 69 of the Acts of 2002 in the amount of $1,250,000 to be used to pay for capital improvements, including but not limited to flood control improvements, street sidewalks, building repairs, playfield improvements and equipment, and funding the building stabilization fund established under Chapter 69 of the Acts of 2002 in the amount of $1,250,000 to be used to pay for renovation or replacement projects for school and town building.
Second. In substantially the form presented, not including Scribner's errors.
Amendment accepted.
Yes. All right, let's roll call vote this one. Bill?
Aye.
Anthea?
Yes.
Paris?
Yes.
Mike?
Yes.
And I vote yes.
Okay. Last motion, I move that the select board direct myself and Chair Michelle Pryor to prepare and release to the community within the next week a document
Within the
summary.
next week?
You can make a friendly amendment.
Oh, I'll be amending that one.
Okay.
I don't even know what you're tasking me with here. Go for it.
Myself and Michelle Pryor. A document summarizing the financial plan as voted on tonight with two parts, a roughly 3-page summary cover memo, followed by a detailed pack showing all relevant elements of the plan, including school and town operating needs, capital needs, cost controls, efficiencies, and non-tax revenue enhancements, tax impact and fairness, and fiscal stewardship.
Friendly amendment that I agree that we should do that, and I think it's a great deliverable. Let's give ourselves until February 25th, which will be, we can have a draft on the 23rd if we wish for the board meeting.
Okay.
And we can finalize it on Wednesday, the 25th. So we'll work on it next week. Okay.
Yes.
Second that. I just gave myself work. Okay.
We've made most of it already. So.
I know. All those in favor?
Aye.
Aye. We do have it. But, okay, so I think our work is adjourned. Thank you, everyone.
Motion to adjourn.
Thank you.
Thanks.